Call this meeting to order. All right, will you all please rise for the invocation and the Pledge of Allegiance? Mr. Tony.
Let's pray. Heavenly Father, I thank you for this opportunity to pray a blessing over our elected county officials. Father, I ask you to be with each one of them as they make decisions that affect their constituents. Father, we thank you for this special season that we are in, this holiday season where we remember you. Father, I ask you to be with all of the citizens in Mojave County, that love and peace and harmony would just abound in all of us, Father. Again, I just pray your Holy Spirit be here in this room as all decisions are made. And we just thank you so much for all that you do for us. And it's in the name of Jesus we pray. Amen. Thank you, Father.
Thank you, Pastor Tony. Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Need a motion to call for executive session to be held January 3rd, 2022 at 9 a.m.
So moved.
Second.
Second, no further discussion. All in favor signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. Committee or legislative reports. We have a legislative report from Coral Evans from Senator Mark Kelly's office. We'll start with that.
Chair, Supervisors, it's absolutely my pleasure to be here again to address you all. I am here for two reasons. First, I need to correct some information that I provided to you on the 5th, and then I have an update on Downwinders. So first, in correction, in my remarks during your last meeting, I incorrectly referred to the infrastructure bill. In speaking about the 3 Mojave projects, your police station refurbishment in Lake Havasu City, the Bank Street Channel Stormwater Control and Reuse Project, and the dental clinic at Creek Valley Health Clinic. The infrastructure bill that was recently passed does not include congressionally directed spending requests, also referred to as earmarks. The projects that I mentioned were included in the Senate FY22 appropriations bill, and as such are likely to be included in the FY 2020 budget whenever that passes. But to be clear, those bills have not passed yet and the budget has not passed. The timing for passage is still up in the air, but it looks like now it will pass sometime in 2022, hopefully in January, but there is a chance that it could be later than that. So I apologize for this mistake and any confusion that I might have caused you all. Second, I do have an update on Downwinders, and I have a printed statement from the senator that I can leave for the clerk to provide to you all. I have 10 copies of that. But first and foremost, Senator Kelly was a co-sponsor on 2 bills for Rica. Rica was raised to him when he ran for office, and most recently when he visited Mojave County early in his term. I believe that Supervisor Bishop spoke directly to him about this issue. The Downwinders bill, Mojave Downwinders bill, this is the first bill, this is Senator Sinema's bill, and it added Mojave County, Arizona, and Clark County, Nevada, to the Rica program. Congressman Stanton is the lead on the companion bill in the House, which had a hearing in the House Judiciary Committee. Senator Kelly submitted testimony at that hearing in support of the bill, and that's what I have for you here today. The comprehensive Rica extension, this is the second bill. This bill was Senator Lujan's bill to extend and reform Rica, including adding Mojave County. Senator Kelly is a co-sponsor on that bill. We worked to get this bill, this proposed amendment to the National Defense Authorization Act, but the Senate did not agree on passing any amendments to the NDAA, so did not make it on. The Rica Trust Fund will technically expire on July 11th, 2022. Team Kelly will be regrouping after the holidays to see if we can find another bill that allows for it to be amended onto. With any of that, do you have any questions?
Supervisor Gould?
Thank you, Mr. Chairman. You said that they were in the 2020 budget when that passes. Does that mean Congress does not pass the budget in 2 years?
2022, fiscal year 2022.
Coral, thank you so much for bringing us that report on the Downwinders legislation, and we still hold out hope that this will get resolved before July.
And I'll leave copies of that statement with the clerk.
Okay, thank you.
All right, thank you very much.
Merry Christmas.
Supervisor Lingenfelter, you have any reports today?
Nothing today, Chairman.
Supervisor Gould.
Thank you, Mr. Chairman. I attended the workforce development meeting on Thursday, and one of the interesting takeaways from that was the one-stop operator was talking about the people that were showing up looking for work. Normally, these folks might have one roadblock to finding a job, but they said that they're seeing a lot of people that have multiple roadblocks to finding a job, which I thought was actually both good and bad. It's good that these folks are looking for work. It's bad that they've got those roadblocks that stand in their way that need to be dealt with. Apparently, they also have a problem with people having ID, which I thought was interesting. Apparently, you have to send your driver's license to the Social Security Administration to obtain a new card. And I think I would be reluctant to put my driver's license in an envelope and put a stamp on it and throw it in the U.S. Postal Service and expect to ever see it again. That's an interesting thing, and maybe Congress could work on a cleaner way to get those folks some ID so they can get to work. But thank you.
Supervisor Bishop.
Thank you, Chairman Johnson. I chaired the Board of Health meeting in Lake Havasu City recently. Also chaired the CSA Executive Board meeting in Phoenix, followed by the CSA Board of Directors meeting, which I also chaired. Later that week, I met with Speaker Bowers to introduce the 2022 Executive Board from CSA and discuss the upcoming legislative agenda that CSA has, where many bills will touch county operations. We discussed the budget, the legislative priorities to include protecting the county taxpayers and investing in Arizona infrastructure like transportation and broadband. Speaker Bowers did state that his top priority this session would be water. I was happy to hear that. And then with Supervisor Gould, I attended the Workforce Development Board meeting. And I also attended a couple meetings on an economic development grant that it's called the Good Jobs Challenge Grant. So finding a trained workforce has become a crisis nationally. And this grant closes in January, and the winners of the grant would get a minimum of $1 million and a maximum of $25 million with a zero match requirement from the county. Mojave County Economic Development and Community Services Departments, as well as Mojave Community College, ASU, would like to apply with Mojave County as the applicant. If this grant is received, it would provide funding to create programs to decrease the gaps for the underserved, and 4 areas of focus would be healthcare, manufacturing, transportation, construction, tourism, and culinary. I think it's very important that we have a regional approach for this grant. We plan to include La Paz County, Coconino County, Needles, Laughlin, Nevada, Mesquite, Nevada, and Washington County, Utah. This is an employee-driven grant specifically to get people trained with 2 to 3 years and make over the county minimum wage specific to the industries. So I just wanted to bring this forward. It's still under discussion, but I think we're at a point now to where a decision has been made by Economic Development and Community Services to go forward and apply for the grant. So this would be huge for Mojave County.
Supervisor Angus.
Thank you. I attended the CSA meeting with Supervisor Bishop telephonically. That's all. Thank you.
Okay, we had the Lower Colorado River Multi-Species Conservation Program meeting. The meeting was hosted by Seth Shanahan with the Southern Nevada Water Authority. After conducting business, Seth turned the meeting over to Chuck Collum, who gave a presentation on the conditions of the effect of drought on Lake Mead. He pointed out that the Lower basin states of Arizona, California, and Nevada are obligated to cut 533,000 acre-feet next year since they are in a Tier 1 shortage. The 500,000 acre-feet would be on top of that, or roughly double the amount of water that they are planning to leave in Lake Mead in 2022. Poor runoff at upstream Lake Powell has skyrocketed the risk of Mead plunging below a dangerously low 1,020 foot of elevation. Chances are now approaching 60%, nearly as high as they were before the drought contingency plan was signed in 2019. This will happen even if every mandatory water cut in the plan is carried out. The estimated bill to do this in 2022 and 23 is $200 million, with the Fed shouldering half. Arizona Department of Water Resources and Central Arizona Project have agreed to combine $60 million. His presentation on the plan showed predictions of what the plan will do. There's a commitment of $200 million in 2 years. Past implementation has all been successful, but there still is a need for additional endangered species take due to the drought. The 500-plus plan, as it's being called, is based on modeling. That modeling suggests that leaving 500,000 acre-feet of water in Lake Mead starting next year could reduce 90% of the risk that the lake falls below 1,020 foot through 2026. John Sweat then gave an overview of the permit compliance with the Fish and Wildlife Service. That is the most effective way to go through Section 7 compliance process. John said they had been working informally with Fish and Wildlife to determine the best approach to an amendment to their permit. This will result in additional take that could be increased if the drought continues. After his overview was discussed the impacts of the water users. This is a very complex issue that will require some very thoughtful wording to meet the needs of the water users. They are drafting an amendment to the permit that are sharing it with the users of the water to ensure the permit meeting the needs of all water users. They should have the draft completed in January and sent to Fish and Wildlife Service before April. If the drought continues, there's no doubt that water costs will increase. As significant as a 500-plus plan is, it is a temporary fix to a persistent problem. The Colorado River that is over-allocated, where there are more rights to use than there is water to go around, a problem that is only worsening as the climate changes. The three lower basin states, along with the 4 states in the upper basin, Colorado, New Mexico, Utah, and Wyoming, are negotiating new operating guidelines for the river after the current set of rules expires in 2026. I also had our cybersecurity IT meeting. John Matlinski is the new chair of the committee, as the prior chair had to step down. They had MSISAC provide a brief explanation of the state and local cybersecurity grant program. It was signed into law by President Biden on the 15th of November. While the Department of Homeland Security hasn't released guidance on the new grant program yet, the MSISAC wanted counties to be aware of what is coming.
Marie Alamedy with the Arizona Hospital and Healthcare Association has joined the conference.
The bill authorized
Has left the conference.
The bill authorized $1 billion over 4 years to enable state, local, and tribal governments to prioritize cybersecurity investments. The way the funding will work, $200 million will be available in 22. The first year of the program, it will require 10% state match for eligibility, 0 match for multi-entity groups, $400 million in 23 with 20% state match and 10% for multi-entity groups, $300 million in 24, 30% state match with 20% for multi-entity groups, $100 million in 25 with 40% state match and 30% for multi-entity groups. It will require states to distribute at least 80% of the funds to local governments, with 25% needing to go to rural areas. The Cybersecurity and Infrastructure Security Agency will be the executive agent and subject matter expert in charge of awarding the money. States and tribes will be required to submit to CISA a cybersecurity plan outlining how the state or tribe will improve its cybersecurity. The state must create a cybersecurity planning committee, and the plan must be approved by them. The committee must consist of representatives from local entities that will bring a more diverse perspective to the table and improve coordination. The grant statute requires DHS and CISA to consolidate with states, tribes, and local governments on grant guidance for applicants, including guidance for the cybersecurity plans, requires them to coordinate on a study of risk-based formulas and develop guidelines for waiver of state share. Coordination will also be recommended for modifications in the cybersecurity grant program. Next, the committee went over the 2022 Naco technology priorities. One major thing is cybersecurity insurance. The premium for insurance is going up for everybody. Other priorities are IT leadership, talent acquisition, and retention. Keeping IT employees at the local government level is hard. Broadband and ensuring access to it, cloud adaptation along with best practices and guidelines for local governments, and support for rural and smaller county technologies, which includes the development of an IT handbook. Some events coming up in 22, the CIO Forum at Naco Legislative Conference, and there are 4 cyber simulations. The first one will be March 14th through 18th, and it will be a ransomware attack on a 9/11 system and backup systems. That's all I have. County Manager?
Good morning, Chairman, board members. No report today. Thank you.
All right, I'm going to go a little out of order to facilitate some people who are here. I will start with item 47, discussion possible action, approve the appointment. What did I miss? Okay, I'll get that. Before I do that, I need a motion to approve October 18th, November 15th, November 17th, 2021 Board of Supervisors meeting minutes.
Motion to approve.
I have motion second, no further discussion. All in favor signify by saying aye.
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 Opposed, same sign, motion carries. Item number 47, discussion possible action, approve the appointment of a Mojave County Treasurer effective January 1st, 2022, to serve until the voters choose a treasurer in the November 8th, 2022 election. We've had a meeting with all candidates. Do we have any further discussion?
Chairman Johnson.
Motion. Supervisor Angus.
I want to thank all of the candidates. All 3 of you are amazing, bring different things to the table. But with that, I would like to make a motion. May I do that?
Sure.
Make a motion to put Sue Ann Mello, to appoint Sue Ann Mello to the position of Treasurer of Mojave County for the period until after the 2022 election.
I'll second.
We have a motion and a second. We have further discussion. I guess everybody kind of knows my feelings. I don't like putting somebody in who's going to be running for office. So.
Can't hear you.
All right, no further discussion. We have a motion. All in favor signify by saying aye.
Aye.
All opposed? Aye.
Nay.
Pass. Okay. Do we have another motion?
Chairman Johnson,
Supervisor Bishop.
I would like to make a motion that we appoint Ken Fielder to the position pending the next election.
Second.
Motion and second. Further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Aye. Any opposed, same side? Motion carries. Congratulations, Mr. Fielder.
Thank you, Mr. Fielder. And thank you to the other candidates, and good luck in your election.
All right, I will now go to item 50, discussion possible action, consider a request from county hospitals for emergency declaration due to staffing shortages. Before I call up the presenters, I had somebody sign up. Jeff Esposito.
Morning. Supervisor Johnson, are you out of your mind? Have you lost your mind completely? This is a nonprofit organization that has basically caused its own problems in overzealous reaction to this pandemic. This is not a county problem. And if you proceed with this, there's going to be hell to pay.
All right, that's the only person signed up. So presenting to us today is going to be the CEO. Who signed up? I did. Yeah, you didn't sign up for item 50. Yep, we're for that item. All right, we have Scott Street, as CEO. We have Will McConnell, and we also have Anna Marie. Who would like to address the board first?
I'm happy to address the board first.
Thank you.
This is Anne Marie Alamedine. I'm president and CEO of the Arizona Hospital and Healthcare Association. Are you able to hear me okay?
I guess so, yes.
Okay, thank you. I just wanted to provide some comments today in support of the situation in Mojave County with respect to hospital staffing and hospital capacity. So statewide, right now, I would best characterize hospital capacity as a tipping point into crisis standards of care. Only 5% of intensive care units are available statewide due to staffing constraints. Only 6% of inpatient beds are available due to staffing constraints. The available beds are in incredible short supply. Statewide right now, over 350 patients are waiting for inpatient admission, meaning they are waiting in the emergency department for a bed to become available, or in other overflow units. Nearly 75% of acute care general hospitals in Phoenix and Tucson, these are typically the higher levels of care that receive transfer patients from rural areas, are reporting overcapacity constraints. Over the next 2 weeks, it's anticipated to get worse. Hospitals statewide will lose agency staff previously funded by the state on a short-term basis, and we simply are competing nationwide for staffing resources. The situation is so severe right now that Department of Health Services submitted 7 applications for federal strike teams to get staffing support because the staffing shortages were so severe, but only 2 of them were filled because of the crisis in Kentucky. So it is truly a significant situation statewide and also in Mojave County. And I'd like to turn it over to your local community hospitals, Warmsey and Kingman Regional Hospital, for their perspective on what's happening in your community.
Thank you. Please identify yourself for the record, sir.
And thank you for those comments. Mr. Chairman and Supervisors, I appreciate the opportunity to be in front of you this morning. I'm Scott Street, the interim CEO at Western Arizona Regional Medical Center. As you can tell, I'm from the South, and I am the interim from Arkansas. I'm with CHS, Community Health Systems, a company that operates 85 hospitals across the country. War MC is our furthest west operation and hospital. I also have served this past year and am currently serving as a CEO in Arkansas and Chief Strategy Officer of five hospitals in Arkansas on the Arkansas Governor's Task Force. And there are 10 of us that are on that task force talking on a weekly basis about the COVID situation. But I have been out here for 6 weeks as the interim CEO, as I just mentioned, and have learned to appreciate the beauty of your mountains and what a beautiful location. But to speak specifically just for a couple of minutes about War MC's situation, and I also am privileged to be joined by Mr. McConnell, the CEO of Kingman Regional here locally. But let me just give you a snapshot of our situation that is critical, and we would say we are in a crisis mode in Bullhead City. Past 3 weeks, we've been in a severe crisis. We're a 133-bed hospital. We're licensed for 133 beds. Past 3 weeks, we have had as high as 28 beds in our 30-bed emergency department. that have been occupied by inpatients waiting for beds in the hospital. And that's been very consistent as of this morning. The COVID situation for us is about 50% of those holding in our ED. So of the 28 I mentioned, about half are COVID related, to give you an idea. We have over 30 COVID patients today in our hospital. That's not counting the ones that are holding in the emergency department. Concerning the shortages of nurses, we have 58 open RN positions currently within the hospital today. 45% of our workforce today is contract labor. That probably will push over to 50% over the next few weeks. And there's a lot of reasons for that you've read about and you're aware of, and I know locally it's the same situation. Is the past 2 years, many in the healthcare field have left local community hospitals to work as contract labor. And as an example, at Western Arizona Regional Medical Center, we're paying right now for critical care nurses and in some areas RN nurses working in the emergency department approximately $180 an hour. That'll give you a little bit of flavor. We assume that will go to over $200 an hour over the next few weeks. 2021 for us as an organization, we spent over $7 million, approximately $8 million for contract labor. If I were to argue with anybody, and I don't mean that in a negative way, I mean in a professional way, COVID is not going away. We've seen the recent spike that we're dealing with today from Thanksgiving. We fully anticipate that through the Christmas and New Year's holiday, we will see other spikes that could even be greater than we've seen over the last 3 weeks. And with that, I'll turn it over to Mr. McConnell to make some comments as well from your hospital here locally. Thank you for the opportunity.
Thank you, sir.
Mr. Chairman, Supervisors, thank you for the opportunity to be here. Let me just start by saying I'm grateful to live in a country where differences of opinion can be discussed in a public forum. It's an incredibly important topic right now, and unfortunately, the topic of COVID-19 has been politicized to such an extent that decision-making has been compromised. So my purpose today is to talk to you about specific hard fact realities that KRMC and Kingman proper are experiencing, as well as the county. The request for a declaration of a state of emergency regarding the COVID crisis is done with full understanding that it may not result in further resources from state or federal support, but that it signals to the community that this is not business as usual. This is a very different environment than I've experienced in my career in healthcare, relative to the volume of illness as well as the approach to illness. So let me start by clarifying a few things relative to the vaccine mandates. OSHA put out a temporary ETS standard several months ago that had a stay of execution placed by the courts. That was overturned last week in the Sixth Circuit of Appeals with a vote of 2-1. That means the OSHA ETS standards are now back in effect for any business greater than 100. And there are opportunities for weekly testing to be an option under the OSHA ETS standards. The CMS mandate for any institution receiving funding from the Centers for Medicaid and Medicare Services is still in the appeals process. It was placed a few months ago. It is currently being appealed. That is creating confusion about what mandate is being followed and at what time. The CMS mandate, when that came into play, was the one that Kingman changed its position, KRMC changed its position, because 75% of our volume comes from Medicare or Medicaid. We would not survive without the ability to see those patients. At that time, we implemented the vaccine mandate. When that was essentially, when that went through the courts and when the stay of execution for the CMS mandate came into effect, we walked back that mandate stance because we were no longer in a position that we had to comply in order to continue with that 75% of our volume. It remains to be seen what happens with the OSHA ETS guidelines and what impact that's going to have. But I did want to mention that that is our reality relative to vaccine mandates. At this time, there is not a vaccine mandate at KRMC. With the news that happened last week with the OSHA ETS, we'll be talking this week to see what our position and our stance is. So I wanted to chat about that briefly. Relative to the volume and the impact that COVID is having in the county and specifically at KRMC. So last December and January was the max surge that we experienced. We topped out with over 1,000 patients in 1 month with COVID. November, we topped out at 762, and we're still climbing. Why this is such a big deal right now? Of the admitted patients, 98.5% are unvaccinated. Regardless of your political position about the vaccine or about the mandates or about feeling forced to take the vaccine, it has an impact on the severity of your illness, and it has an impact on your length of stay in our hospital. If you have COVID and you are not vaccinated, your stay in the ICU is likely to be 3 weeks or longer, and it is a very high mortality rate. A couple of other things relative to just the numbers and what we're experiencing. There are individuals that state that this is a self-fulfilling prophecy and that this is something that the healthcare institution has put in place to drive volumes. I can tell you right now, if that was the case, I would have done it in a way that I didn't have to pay $20 million for 41 nurses to cover the volume and the crisis standards that are happening within our hospitals. This is not something that can just be thought away or ignored away. The lung tissue and the images of someone who has COVID versus someone that has not had COVID, it changes your lung imaging. Emergency physicians can tell immediately if someone has had COVID by how their lungs show up on an x-ray. The challenge that we have with vaccination is in order for us to discharge someone to a nursing home for continued care, they must be vaccinated, or there has to be a 14-day quarantine with a negative test allowing them to enter a nursing home. That extends the length of stay in our hospital, and it makes it less likely for us to be able to take care of other issues and other emergencies and other patients because we are full. This is a crisis of staffing. There are beds, but we do not have the staff to care for those beds. Last year, we did receive some federal help. It came at the tail end. That was in the January, February, March timeframe. That help is not coming. We have low vaccination rate in this community, but high monoclonal antibody administration. So monoclonal antibody is the treatment that you receive relative to testing positive for COVID or having a high-risk exposure to COVID. And what it does is it helps your body fight off the illness. We don't have high vaccination rates, but we are running 22 people through that clinic Monday, Wednesday, and Friday, which is all we can staff because of the staffing issues. We've had to close our acute rehabilitation unit in order to funnel staffing into the ICU and into other critical aspects of the hospital because we're trying to take care of as many patients as we can. I want to read the following statement, just simply because if anything comes from this, it's the potential for a declaration of emergency to signal to this community that what we are experiencing is not something that can be explained away. It is having a profound impact on the hospital. It is having a profound impact on the way we deliver care. If we have to start limiting our staffed beds because we don't have staff to have them, more and more people will need to be transferred out of this community. For something that we can prevent hospitalizations, and we can prevent severe illness. So, the situation in Mojave County hospitals is serious. The ongoing pandemic is threatening your access to health care. Anytime you or a loved one might need our support, heart attacks, car accidents, stroke, appendicitis, now an ominous question looms. Can you get care from your local community hospital without delay? Today, that's uncertain. All hospitals in Mojave County are severely strained. Our emergency rooms are backed up, and our staffed patient beds are full. The problem is being compounded by a nationwide shortage of healthcare workers. There are few resources available to relieve our overworked and exhausted staffs. The situation is serious. If the number of people needing hospitalization were to exceed available resources, we could find ourselves in the worst-case scenario, when patient care must be triaged, like on a battlefield. We never want to get to that point, and we need your help. We need your help to protect your health. We need your help in this community. Ways to help. Maintain a healthy lifestyle, eat right, exercise, and get enough sleep. If you have a chronic condition, take your medications as directed by your doctor. Get the COVID-19 vaccine and booster to reduce your risk of severe illness and hospitalization. Avoid crowded places, but if you must go, wear a mask. If you have COVID symptoms, get tested immediately. You may be eligible for treatments that can reduce your risk of hospitalization. We need your cooperation. Even with the current circumstances, never delay in seeking proper medical care for an illness or injury. This is vital for preventing your condition from becoming worse and for avoiding hospitalization. Learn about same-day medical services available to you in your area. However, if you need immediate medical care, it's extremely important to call 911 or go to your nearest emergency room. Providing life-saving care is always our highest priority. We want to be here for our community, and we want to take care of our community. Our percent positive in Kingman is over 20%. The percent positive for Las Vegas is 7%. The only difference between, at this point, is their adherence to masking policy and other vaccination status, right? Their rate of vaccination versus ours. So ultimately, that's our reality. That is what we're experiencing. This is not about driving volume to our facility. This is about, we are at a point where we are going to be in a position to limit care to this community in order to maintain staffing levels that are safe. Thank you.
Thank you, sir. Do we have any questions from the board? Supervisor Lingenfelder.
Thank you, Chairman Johnson. Mr. McConnell, thank you for being here today. I just have a couple of questions.
Yeah, please.
It was mentioned earlier that staffed nurses more and more are leaving to become contracted nurses.
Correct.
Why is that?
So when I alluded to 41 nurses from a travel agency would have a yearly cost of $20 million, that's why. So when you're a nurse and you're making the standard nursing wage and a traveler comes in, because we have to bring a traveler in to try to continue to take care of the community, they're working next to somebody who may be making 2, 3, or 4 times what they are. That is incredibly demoralizing. Healthcare workers have never been more in demand than they are presently. And I personally don't begrudge anyone for taking an opportunity to increase their earning potential over a 1 to 2 year time frame. The pandemic will end. It will become endemic. It will become much like the flu in reality. But that's the situation that we're dealing with. The other thing that we're dealing with is people close to retirement are saying no more. This is not what I signed up for. I spoke to an ICU NP. She is at her end because ultimately declaring 6 people dead on a weekly basis has a tendency to affect you. And so people are retiring. And then you have nurses who are getting ready to enter the workforce, and some of them are saying, not right now, this is a mess. And so that squeeze is really impacting staffing and the morale of every healthcare worker at present, because for whatever reason, there's been no ceiling on what these staffing agencies can charge. And so, I mean, people are taking advantage of it, and it's affecting local hospitals. And really, I mean, we've lost some nurses to go travel and work at Havasu. And Havasu's probably lost some to come work for us. But it's a mess. plain and simple.
So the short answer would be that they're leaving because they're making more money and they have maybe more control.
They have potential to make more money. I would question whether they have more control. What is unclear is, let's say I contract with a staffing agency to fill a hole that's critical, or we have to close beds at $200 an hour. It's unclear how much of that goes to the nurse and how much goes to the staffing agency.
Got it. So I hear your message on COVID. It sounds like you're blaming everything on COVID, but would you say that it's a combination of a bunch of different factors, maybe a patient to nurse ratio and other things like that?
So we've
that
kept
are
our
combined
patient to nurse ratio the same through this. It's been something that we've worked very hard to maintain. I will state it this way. COVID is exacerbating many other issues. People delaying care because they're afraid to get COVID means they end up in our ICU or in our ER with a more critical need that could have been managed with medication and other visits. So COVID is not the only reason we're at this point, but COVID is absolutely exacerbating things. With the length of stay, for example, if your length of stay in an ICU is 5 days versus 21 days, it allows us to provide more care because there's turnover. COVID and COVID illness is creating longer lengths of stay in the hospital, which means we have less turnover, which means we can take care of less very sick people. So that's an effect that COVID is having, and it's compressing all the other resources because the length of stay is just so much longer than we're used to. And to those that say, well, the length of stay means you get paid more, that's not what this is about. There is set reimbursement based on condition, and it's still unclear how that's going to end relative to COVID. Let's put it this way. We are likely to end this year with an operating margin of less than 1%. Explain to me how that is capitalizing off of COVID. We are trying to manage staff every way we can. We've actually provided over the past year about $6 million in bonuses, as well as moving forward the timing of raises to try to keep our staff. We're trying to be creative in every way to keep them, because the more staff we lose, the less beds we can safely staff.
The only other question I have is, one of the things you mentioned was the monoclonal antibody treatment. Something that they can do in-home and not in the hospital, correct?
Not necessarily.
They get a diagnosis?
So monoclonal antibodies, you either have an infusion or there's a subcutaneous underneath the skin injection. Both of those need to be monitored. The FDA is currently testing a pill administration for monoclonal antibodies, but that has not passed through the necessary testing to be administered. And I'm going to look at my ER physician to make sure I didn't. Okay, so I got to fact check myself.
Right.
So that's where we're at.
Okay, thank you.
Absolutely.
Supervisor Angus.
So you're here today because you're asking us for an emergency declaration, which we don't have. We haven't seen anything. And what would that do?
So for me, what that would do is it would signal to the community, it would signal to the county that this is not business as usual. This is not just a flu surge. This is not just the normal everyday thing. We are taxed at a level that will impact your care if we don't resolve it. And that, in my mind, is a state of emergency. If we have to turn you away from our hospital because we don't have the staff to take care of you in the beds that we have, or because there's just no room, to me that's a state of emergency, because you're no longer able to receive care in your local community.
So it's just a statement from the county.
Correct.
Doesn't really do anything. So
I understand that it's
you
not
just
gonna-
gave your explanation, and hopefully the newspapers will do their job and maybe even call you up and interview you, and so people know, because I do think people know. I think for the most part people know. I just don't know, I'm very hesitant in supporting anything that A, I haven't seen, and B, that I don't know what the other ramifications of it will be.
I apologize. Can you clarify what you haven't seen? I'm not sure I'm following.
A proclamation. Like usually we see what it is that we're being asked. So you're just saying right now, Chairman Johnson, that if we were to say yes, that this, then it would be written. I just don't see the importance of it from this body. It seems to me that you should spend your time going to the state, going to your federal elected people, and if this is a rural or even a nationwide problem, then they should be doing it, at this level. There's really nothing, and I just don't really see the necessity of an emergency proclamation when we've had emergency proclamations before, and we found out later that it binded us in other ways, and I personally don't really see that. I understand. I feel your pain. Mr. Street, Warmsey is in my district, and there's another hospital down the street. How do you guys work together? I mean, if beds are a problem, I don't really see them reporting as much. Is there a problem there? Is there something that you can do to work with that hospital for the whole county? I mean, they have beds there, I assume.
Yes, ma'am, we do. And so we have been in contact almost daily with Valley View to stay in contact with the number of beds that they don't have as well. And to Will's contacts and to his point about staffing, it really goes back to what we have available. So I mentioned we have 133 beds that we have licensed, and could, from a normal staffing standpoint, get up to about 120, and can go in detail on that. But as of right now, we can only open up 73 beds due to staffing to keep that same ratio. And we do utilize as much as we can across the city between the two facilities with our staff. But just as Will mentioned, that unfortunately what's happening is a lot of our staff will go with contract labor, contract companies, and we end up having to use staff from those companies. And they may work right down the road from us.
Okay, when this thing first started, each hospital had an emergency plan for this kind of thing. If you should run out of beds, I know Warmsey had, I think, down on the Hancock offices. Are any of those things being utilized during this period?
Okay, Will mentioned he could speak to that. I do want to just make one note related to one question you asked earlier, and then if you would step in and help answer that. I did pull an article this morning that states turn to National Guard for hospital staffing. And those states are Ohio, Indiana, Maine, and New Hampshire as of today. I'm also aware of 5 other states that are looking into the possibility of enacting the National Guard. We don't know the impact of the Omicron virus, that is the new virus that is approaching and is here in the United States within every state today. And so that is another form of urgency is what we see
Right.
from Christmas.
My point is that to actually do something instead of just saying something. I'm sure you have lobbyists that work with the state and federal government. If this is the emergency, which I'm not doubting you that you say it is, then that's really where you should be putting all your efforts into, not an emergency proclamation from a county board that is basically meaningless.
So I respect that, but I disagree, and here's why. The number of man hours that we have spent trying to get aid from state and federal sources and how those resources are allocated it's challenging. We receive staff for a crisis 2 months after things go down. The issue in my mind is less about, well, let's put it this way, your question about the emergency declaration and the comment about emergency plans. We have been in an emergency planning position for 18 plus months, since May and June of last year. There is no viable resource that is coming to help us, and the staff that we have are leaving. While there may be no specific action that declaring a state of emergency does, what it does to me is it demonstrates that this is not a politicized issue. This is a reality in our hospitals that is creating a situation where if we don't find a resolution, we will limit care that sick people need, and we will be in the position of implementing battlefield medicine. That is something that we as an entire community need to come together on. I don't understand the same way you don't understand the inner workings of a hospital, I don't understand the inner workings of local government. What it means to have a petition or a statement reviewed for a state of emergency versus discussing the topic and deciding on a course of action, I don't know. I'm simply stating the facts of the volume and our inability to take care of the patients in this community if we don't find other ways to support and come together. And one of those, and I know I'm going to hear it from the audience, is vaccination. That's part of the reality. It prevents serious illness and it prevents hospitalization. That is scientific fact. Unfortunately, scientific fact has become politicized in the environment that we're in right now to our detriment. So that's why.
Okay, and you talk about political fact. And this is not where this is going, but you're talking about the longer the stay. Do you guys, if I come in and I'm very sick and my husband wants to give me ivermectin, would you give it to us?
Yeah, I'm not going to get into that detail.
Well, but those are all the things
right,
that
I'm not a physician.
I understand, but those are all the things that would go into solving this emergency.
So one of the things related to that we're looking at publishing is a group of our pharmacists and a group of our physicians putting out a position paper on all of the treatments available with scientific evidence of efficacy and appropriateness. I can't speak to that right now, but just know that that is something that we're doing because I'm aware from the last meeting that some of our physicians and pharmacists attended that was a significant concern. So we are in the process, and we're also going to work with Mayo jointly to put something out in that regard. So that is coming. So I appreciate the question.
Thank you. That's all I have.
Chairman Johnson.
Lingenfelder?
Thank you, Chairman Johnson. I agree with you that politics and medicine don't mix very well, and COVID has politicized medicine, right? But what I don't see as being politicized is a staffing shortage, and that's what I'm hearing. A staffing shortage is not politicized. It's a reality.
Yeah.
So how, even if you get a emergency declaration or something down the way, and I agree with Supervisor Angus that I wouldn't want to approve anything that I hadn't been able to read first.
Sure.
Let's say you get one and there's still a staffing shortage, Mm-hmm. How are you going to address that staffing shortage long term?
So staffing shortage long term versus staffing shortage short term. Staffing shortage short term is a crisis. Staffing shortage long term starts to decline as COVID changes from being a pandemic to endemic, much like the flu. The reality is the only way that we're going, staff is not coming. We can't afford to pay what staffing agencies are charging. The support that we've had has been from the state level, but that is over in 2 weeks. You talk about emergency plans. We're talking on a regular basis on what that looks like. The vaccination status of this community has an impact on the percent positive, has an impact on the number that we have to admit, and has an impact on how long those patients stay. So whether it's state of emergency, whether it's a different position on vaccination, whether it's a different position on COVID as a whole, for us to get through this, it's a combination of us finding ways to continue to redeploy other staff, to close other units so that those nurses can help us in the four walls of the hospital. And it's going to come down to vaccination rates. I think the more people that get the monoclonal antibody treatment, it's one way, but again, it's an after the fact thing. You have COVID or you have a high exposure, ivermectin is a solution. If you want to have COVID in a less severe way, up front, the vaccine helps prevent, helps on hospitalizations, helps on our ability to turn over beds, which means we're able to take care of more people. So if we've got 100 people that are going to be in the hospital for 2 or 3 weeks, our ability to take care of other people goes down, period. So hopefully that helps answer the question.
A little bit. I'm still centered on this staffing shortage.
Mm-hmm.
I'm sure you know the levels that, okay, we consider KRMC in crisis versus not. I mean, And I'm not in the hospital business, but it would seem like if you're getting all these staffing nurses going to contracts, I'm sure you guys are doing everything that you can to try to be competitive with
Absolutely.
what you're actually paying, right? It's a tough situation to be in.
I appreciate that.
I just don't know more about the staffing crisis part of it. I mean, how long has it been going on, and what do you need to achieve by this? How's this going to help you with your staffing shortage?
Yeah, so the link for me is if this changes the mind of even 100 people to decide to get the vaccine instead of not, that can help us in the short and long term. The staffing, we've been in this position, unfortunately. When we weathered the storm last year, December and January, when we were at about 1,000 cases per month, we've lost staff from that point to this point. The hospital as a whole is down 340 positions. That's not all clinical, but we're down 340 positions. We're continuing to have that chipped away at. So I don't know what that means long term. If we end up in the situation where instead of, our census today, is 145. 50 of those are COVID related. If we can only take care of 120 or 90, we're just going to be chipping away at our ability to take care of this community, and that's the only way the staffing shortage is going to be addressed. We don't have access to that. Strike forces have gone to other areas. You heard Anne-Marie Amladine talk about there were some slated support, but they ended up getting diverted to Kentucky. So ultimately, our plan is we continue to close beds in proportionate to our ability to staff those.
Let me ask one more question.
Please.
And I think I heard, I'm going to make a statement, and you correct me if I'm wrong, but it sounds to me as though you want to use this emergency declaration to compel people to get vaccinated.
This is not about compelling. This is not about compelling. This is about making a rational choice in your best interest with all the facts. This is not about compelling.
Would the resolution, first of all, who would write that? Would it be the hospitals, and would it
we would not
try to push kids getting vaccinated?
No, we would not link this to the vaccine. This would be the agenda item is specific to staffing. I'm simply answering questions about the vaccine's impact on our patient load and how that relates to staffing.
Okay.
We would not. There's no place for that type of move.
Do you have a draft resolution?
We can share that with you this afternoon. Absolutely.
Supervisor Bishop.
Chairman Johnson, switching gears a little bit and moving away from the hospital, I'd like to read an email from the Cornerstone mission that was sent out this morning. I'll just read part of it, but it says, "It is with a heavy heart that I am writing this email. After much thought and reviewing our pandemic plan, Cornerstone mission has no choice but to temporarily close our doors and take care of the folks that are in our shelters. Currently, 65% of residents and 50% of our staff are COVID positive and are not feeling well. This is a tremendous strain, and choosing to shut down and quarantine is our only option. This is a hard decision and one we do not take lightly, but is our only solution to stop the spread and allow for all of our folks to heal. We have many volunteers reaching out to help here and express that they do not mind helping because they are vaccinated. The residents and staff that are currently sick are both vaccinated and unvaccinated. This is also having an impact on the emergency workers in our community, as some have needed emergency services. This means that for the first time in over 19 years, we will not be accepting any new intakes into the shelter, offering walk-in services, or providing meals to the public." So I just wanted to point out there's other things that are going on within our communities related to what you're asking us to do today. And my question to this board is, I know we're a little hesitant to declare an emergency declaration, but I would not be opposed to writing a resolution or a proclamation that just makes a statement that this is serious and these are the reasons why, according to our hospital officials. So that would not be binding on any legal emergency declaration language. Thank you.
Thank you, sir.
Thank you. Appreciate the time.
Oh, 1 second. Supervisor Gould.
Thank you, Mr. Chairman. Sir, you came down to us and asked for a not political decision, and that we should throw politics to the wind in a political environment. Frankly, I think that's kind of ridiculous that you would ask a political board to make an unpolitical decision, because that's just against our nature. But it seems to me that the best thing that you could do as a business is to stop attempting to force your staff to be vaccinated. If they're not going to show up for work because you're forcing them to be vaccinated, to me that seems like the best direct action.
So I'll refer you to my first statements, but I'll say them again. Direct forcing vaccination to the right address. I would like to see this board accomplish anything with 75% of your revenue. Well, sorry, I misstated that. 75% of your volume gone. We held off.
I don't believe that the federal government will enforce that. I think it's an empty threat by the Biden administration.
So it is a condition of participation under Medicare. So this is not something that was taken lightly, and the second it had a stay of execution in the federal courts, we walked that mandate back. So I want to be clear, the hospital has taken a position that vaccination status was not mandatory unless there were no other options. Even under the OSHA one, we had other options. It was not mandatory while that OSHA ETS was in place. The second CMS said it is a condition of participation. We went to the vaccine mandate with as many avenues for exemptions, whether it be religious, strongly held belief, or medical as possible. The second that was put before an appellate court and they put a stay of execution in place, we took that mandate back. So the facts of this need to be very clear about my position and the hospital's position relative to vaccine mandates. I do not want misinformation to continue to go out around our statement.
Does the Medicare and the Medicaid stay still exist?
I'm sorry?
Does the stay on the Medicaid, Medicare, vax mandate still exist?
Yes, which is why we're not in mandate position right now.
Right.
But OSHA,
and the one that's been lifted is the OSHA one.
OSHA was just repealed, and that is in effect for any business over 100.
The stay was lifted.
Correct.
It still
for
is subject
OSHA
to a
ETS.
Supreme Court challenge.
Correct.
Many businesses are challenging that.
Yeah,
I think your
I'm not
business
talking
has a
about
more
that one.
direct effect. That the best thing you could do is to back off on vaccine mandates so you don't run your staff off.
That's the position
You're
we've
making a
taken from the
moral
beginning.
choice here. You're making a moral choice.
not.
We're either going to bow to the government or we're going to take care of the people that we promised to take care of. That's
No.
what it boils down to.
I completely disagree with that position.
And you're allowed to do that because this is America.
Yeah, absolutely, which is what I'm grateful for. And I'm happy to come back if we want to create a working session between hospital administration and local government and county government and work through this together. I'm up for that. I cannot take a political stance as a hospital. You can take a political stance as a county. There is a very different game to be played relative to the organizations we represent. I am not in a position where I can afford to thumb my nose at 75% of our revenue if you want to continue to have a community hospital.
The other issue is that there's people waiting for this board to tell them what to do. I find fallacious also. The people that are concerned about COVID are not waiting for Ron Gould to tell them what to do. The people that are less concerned are not waiting for you to tell them what to do. The problem is they've lost trust in their government.
Fair.
They've been lied to repeatedly. They've had the rules changed on them repeatedly.
Fair.
They were told if they were vaccinated that they could go back to their normal life. That was a lie. This is the problem. Nobody trusts. So when we put out this edict, it's not going to make a darn bit of difference.
Yeah,
because they don't trust us.
And part of it is, even if nothing gets put out formally from this meeting, this is an opportunity for the hospitals to share our current reality. And for me, that's important that you all have that context. It's important for me to understand your context relative to local government. So if all this did was further cement people in their camps, so be it. If it brought up points and data points for somebody to question their own confirmation bias and look at something differently, then in my mind it was successful. Even if nothing comes from this, we have to have this stuff out in more forums so that we can have dialogue like this, so that we can figure out what the path forward looks like. At some point we're going to be past this. There better be enough pieces of everybody's interpersonal relationships to put back together so we can continue in some reasonable way forward.
Thank you, sir.
Chairman Johnson?
Supervisor Lingenfelder.
I'm not sure exactly how, well, I won't say. I agreed with Supervisor Bishop's thought that maybe a resolution or something could be crafted and brought to the board for review. Would that...
Appreciate that.
Whether it's a resolution or an emergency declaration, does it really matter to you?
It doesn't. It doesn't. It's simply demonstrating as many parties working together to find a path forward. That's the motivation.
And if it was a resolution, I think it's fair to say that the Board of Supervisors should have the opportunity to review that and read it.
Without a doubt.
Before they were asked to vote on something.
And in fact, I would be happy to jointly craft. I'd be happy to send that back and forth for review until it's something that you feel like you can support. And if it's something that you couldn't ever get to supporting, there's no reason to bring it forward. I wouldn't do that.
Did you want to make a motion?
Well, I just want to let everybody know I put this on the agenda. It came to me at the last moment. Anytime a health and safety issue comes forward and they're thinking that it's an emergency, I feel it's up to the board to take a look at it. I believe that one thing that right now, and I don't know if it's because of lack of communications, but you're having these people stand up here and tell us how their hospitals are short of beds. And it's not about, to me, it's not about COVID or anything else. It's about, you have a heart attack, you get in a car wreck, is there a place for you to get, get medical attention, no matter what the problem is. But I'm not seeing it from anything from Lake Havasu. I guess, and I have no problem with the resolution that says these hospitals are short-staffed. It just bothers me that I have no communications from Lake Havasu. I don't know if our health department wants to contact them or knows anything about them, but I would think they would have the same problems, because if we go ahead with this, I don't want everybody in Havasu thinking, it's fine for us to get in car wrecks, so.
I'll make sure that Mike Patterson is involved. I did reach out to him via text about this meeting. He unfortunately had corporate meetings that he had to attend, but I will absolutely pull in both Havasu and Valley View into the drafting of a potential resolution so that it's not split in the way that you're implying.
All right, if we do this, all we need is the information from you. We'll do all the crafting.
Okay.
Chairman Johnson, I just have one last question, if I could.
Supervisor Langfelder.
Thank you. Do CareMC and all the other hospitals, do you guys speak regularly?
Not as often as we have in the past.
See, I think that's a part of the problem. If you look at what's happened up here prior to the creation of the Kingman and Mojave Manufacturing Association, that's a manufacturing sector strategy. And if there's anything that we need that's going to help you guys, all of you, with staffing and all those things, it's creating a Mojave County Health Care Services sector strategy. I don't know why you guys haven't done it already, but I mean, if there was any call to action to do something like that, it's now.
Appreciate that.
Just my opinion. Thanks.
Yeah, thank you.
Supervisor Angus.
One more thing. I'm more solution-based, and we talked a lot, and I don't even know if you know really what the solution would be for the staffing issues, but I would be happy to work with you behind the scenes with Mr. Street from my district and put together my contacts from the state and the federal government and really do something instead of this type of thing that I just find, style over substance. I'd rather actually figure out what it is, or help you figure out what it is that you're going to need to go forward, because that is the problem, is the staffing issue. Again, how we got here, why we got here, the differences on what we should do in the future. Right now, there's a staffing issue, and people who are listening today or even in this room will might be affected from it. So that is my offer to you in lieu of some of this stuff.
No, I appreciate that, and I will take you up on that. And the intent was to bring substance. My children will be glad to know that this is the first time someone's accused me of having style. So appreciate that.
Got it.
Thank you.
And I guess I don't really see a solution for it. I mean, they're short-staffed. I mean, not just here. Nationwide, we're short-staffed. We're not going to get more people. We can still keep using the National Guard, but, you know, we're going to burn those people out. I think it's just something that we just need to basically let our people know that, you know, there is a problem, so take care of yourself. Do I have a motion? Supervisor,
Did you want to make a motion, Chairman? Or
I'll let you do it, Supervisor.
Goodwill, I'd make a motion that you work with Public Health Department to bring back a resolution for us to consider at the next meeting.
Okay, I'll second that.
the motion second for discussion. Hearing none, all in favor, signify by saying aye.
Aye.
Any opposed, same sign.
No.
Two noes, right? All right.
Thank you.
All right. Item number 40, update from High Ground on water issues facing Mojave County. Supervisor Lingenfeld.
Thank you, Chairman Johnson. It's the end of the year, and we brought up High Ground to give everyone, the board and everyone that's watching, hopefully the media will pick up on this stuff, an overview of all the water issues that Mojave County is facing, continues to face into next year, including a preview of the legislative efforts during next year's 55th Legislature second session. We'll touch upon the Wallapai Valley Basin groundwater efforts, the Colorado River water transfer, and hopefully getting some new law that prohibits future transfers. We'll touch on the 2026 guidelines, the negotiations for how the Colorado River is used, and the 500 plus plan, as Chairman Johnson talked about. And also we'll touch briefly upon the Wallapai Tribe water settlement. So with that, Patrick.
Mr. Chairman, members, Patrick Cunningham from High Ground. Pleasure to be back with you again. I was last here in June, and I brought presents this time. I brought Mr. Nick Ponder, who is our brand new Vice President, Senior Vice President for Government Affairs. He joined High Ground on December 1st, and we got him from the League of Cities and Towns. He's a veteran of being in the legislative process. He's been their legislative director, I think, for the last 3 years. So you will see me and you will see Nick and maybe a few others in the coming months. I wanted to make sure you got to meet him live and in person. He did graduate from the Ohio State University, so I wore my Michigan button today to make sure that we try to keep him in line. It's a difficult task. So welcome, Nick. So Nick will be hanging out here and correcting me as we need to. Mr. Chairman, we're going to go through the 5 issues that Supervisor Lingenfelder just laid out. And as always, members, please interrupt any time. If we end up talking about the issues that you want to talk about, that's exactly what we have accomplished.
And Almadine with the Arizona Hospital and Healthcare Association
has left the conference.
It's a shame they would have learned about water. Mr. Chairman and members, we'll go through some slides at the end too, and a little bit more detail of what the chairman read earlier about the 500 plus plan. So I appreciated that, Mr. Chairman. That was a great background. So we're going to dive into all 5 of those. Let's start with the first one, the preview of bills at the legislature. As you guys know, Representative Cobb has introduced 3 bills in running succession, and I expect that she'll introduce those again. One will be the Rural Management Area Bill. That's to manage groundwater in rural areas where there is currently no law whatsoever from the legislature. It's unregulated. That bill will be introduced, and it has been the subject of a long study committee. The study committee issued 10 recommendations recently in November, and that process of drafting that bill is ongoing right now. There'll be a bill on Colorado River transfers again. This board is well aware of the Colorado River transfers, and we'll talk in detail about those that have been ongoing. We expect a bill on that topic. That's been a topic of discussion at Valley Partnership forums and elsewhere. The legislature is very interested in this. There are people in the central Arizona very interested in that because there are many transfers waiting in the wings if the first one is successful. And the third bill is an irrigation non-expansion area change. The governor's office raised this way back in 2017. It would allow the Department of Water Resources to look prospectively regarding the issue of irrigation non-expansion. You'll recall that this board has sent 2 letters to DWR to try to have an irrigation non-expansion area in the Wallapai Basin. That would grandfather in the current farms, but it would stop future farms. Twice that's been turned down because there's water there now, and the current statute only allows DWR to declare an irrigation non-expansion area when there's not a reasonable amount of water for ongoing irrigation. That means you have to pump the aquifer virtually dry before you get an INA. A lot of people think that's the wrong policy. That bill will be introduced again, and we're trying to use that creatively on the RMA bill. Those 3 bills we expect will generate lots of publicity and lots of debate. Whether they'll get a hearing or not, we'll let you know. And because Supervisor Bishop is heading up the CSA legislation, she'll learn all about that. And of course, we'll keep Supervisor Lingenfelder, our water lead, fully informed about all of this. Wallapai Basin groundwater. The next topic. The board may remember that way back in October of 2020, USGS came to report on a model that you guys paid half of and the city paid half of about how much water is in the Wallapai Basin, how is its health. And we have 2 studies now that bookend that health. One is the matrix study that assumes that all of the current farms would plant alfalfa and use lots of water to irrigate that. That showed that the Wallapai Basin may have as little as 58 years of water left before it reaches a level that is so low that it doesn't meet the regulatory standard for reasonable availability. You guys did a separate model done by USGS, which the county now and the city now own and can rerun over a period of time as things change. That study took a more realistic view of assumptions and assumed a lot of this land would not be cultivated and assumed that the crops would be moved from alfalfa to other crops like pistachios, like onions, like other things. That model run resulted that there's over 100 years of water left. There's not the 200 years of water that we had in 2010, before all the farms moved in. Remember, in 2010, we weren't doing agriculture in Wallapai Valley Basin. Now we are, big time. So you've got bookended models. One is a real numeric model that you can reprogram as we learn more, and one is the baseline study done by Matrix for DWR that the legislature funded. We now face a situation of what will happen with all of the land that is currently vacant and owned by farms, and what will happen with the new farmers that may move in from California or elsewhere, or may not move in. The Rural Management Area Bill is designed to plug that gap and to allow the rural management area to be declared by this Board of Supervisors, and then a local committee would design management plans to manage that groundwater. That's the concept of the RMAs. 10 recommendations came out of the committee. That will now be drafted, and we'll see in the coming session whether that bill is taken up. We'll be back with you for more information, and we may come back to you specifically asking for board approval and board input on how that bill moves forward. That's Wallapai Basin groundwater. Turning now to Colorado River transfers. The celebrated transfer is the one that's ongoing right now with Queen Creek and whether Greenstone, which is a hedge fund from back east, and the town of Queen Creek are going to be able to move 2,000 acre-feet of water from Cibola, which is south of Parker, moving it from Cibola about 200 miles to the east to Queen Creek. That is not the first transfer, though, that this board has had to contend with. You'll recall that the first transfer was Quartzsite. The town of Quartzsite was going to lease 1,000 acres to Central Arizona Project. Water Asset Management did the second transfer proposal. They were going to lease about 2,000 acre-feet to the Central Arizona Project and the Central Arizona Groundwater Replenishment District. The third is creation of ICS, intentionally created surplus, by our friends at MVIDD, Mojave Valley Irrigation and Drainage District. That's a process that's ongoing, by the way, and they have been able to create ICS, and it is strengthening Lake Mead by leaving more water in the lake, which we'll talk about in just a moment. The issue with ICS is under the current guidelines, they could transfer that to the Central Arizona Project, and that water would go to Central Arizona and not stay in the lake or not stay along the river. That's why ICS is something for this board to watch. And then we have the Greenstone transfer. The current status of the Greenstone transfer. Bureau of Reclamation is doing an environmental assessment. The chairman signed a letter in September that explained in detail to the Bureau of Reclamation why this board would like to see a full-blown environmental impact statement to assess what is the effect on the river communities, and including Mojave County, of transferring 2,000 acre-feet to Central Arizona and having it leave the river communities in perpetuity. We have raised two fundamental issues in that letter. One is that DWR first approved a transfer of 1,000 acre-feet, keeping 1,000 on the river for use up and down the river. Then, in a reversal, they added another 1,000 acre-feet, so now there's about 2,033 acre-feet going to Central Arizona and only 50 acre-feet left on the river. They did that without a public process. They changed their recommendation without a public process. The county has made clear in the chairman's letter, we've got to have an analysis of that, about how in the world you can move 1,000 acre-feet without a public process. Secondly, the long-term drought we all face. The chairman's report earlier about the multi-species conservation area and the long-term drought we face, it does not seem that in the middle of a long-term drought that is as bad as it was 1,500 years ago, where we faced 22 years in a row of really bad hydrology on our river. It does not seem that that is the time to transfer water to Central Arizona and away from the river. That's an issue we think they should explore during their EIS. If they don't do an EIS, then we'll be back to the board for a decision about whether you want to take any action regarding that. They may finish that in February. They may finish that in the spring. We'll be back in touch when they do. One of the issues pending in the legislature is, well, what about these transfers? Just as RMAs got a lot of attention, the transfers have gotten a lot of attention. And recently at Valley Partnership, the Speaker of the House Rusty Bowers talked about how the need for us to figure out what we're going to do on these transfers because they are very controversial. And obviously you're right in the middle of that maelstrom. He has raised the issue about what do the river communities need for their future growth? And that raises for us at High Ground the concept of a water budget. And we have proposed to Supervisor Lingenfelter and to County Manager Elters that a water budget for the basins that are along the river is absolutely something that we should work up, and that the staff should work up a possible budget. And the way you do that is you look at all the private land that could be developed, you look at the available water, you figure out what the delta is, and you look to possible sources. So that's a problem for each of your districts because each of the basins have problematic issues. Even though the Lake Havasu and Mojave basins look right out at the Colorado River, there's no groundwater in those basins or very, very little, it's Colorado River water. So if you don't have a Colorado River allotment, then you have difficulty developing your land. So we need to develop and find out how much more water we need. There are developments right now that have platted lots, and they can't sell anymore because they don't have an additional Colorado River allotment. But then there's other basins. The basin, obviously, in Wallapai Basin needs a water budget, but Meadview may need a water budget. As the water in some wells in Meadview decline, we need to figure out, is that because the Colorado River is declining? Is it because it's of nearby pumping by farms? And what is the status of that basin, and what is the water budget for that basin? So those basins are very much at risk. And then we turn to the basin that is closer to Bullhead City, north of toward Hoover Dam. That basin has some groundwater, but it has a lot of private land to be developed that's on the way to Las Vegas. That basin needs a water budget also. So we expect that you'll see movement on that front, and the use of the water budget in figuring out how much water Mojave County needs, along with Yuma County, along with La Paz County. That will be important in these water transfers, in our view. Turning now to the guidelines of the Colorado River negotiations. You have heard from us before, in June for sure, and actually before that the Colorado River guidelines are being renegotiated. The guidelines currently, in fact, started in 2007. It goes through December 31st of 2026. These are the guidelines that control how we operate the river and how the United States Bureau of Reclamation allocates water. We expect that that negotiation will be long because you have 7 basin states. You have at least 10 tribes on the river and maybe more. And of course, you have the federal government. We have to get all those people together to figure out the new guidelines. Superimposed on top of that was the Drought Contingency Plan that was approved in January of 2019. That's an historic plan. That put a lot of water in Lake Mead. And now the crashing hydrology of the river has forced us to confront the 500-plus plan. The 500-plus plan, which we'll talk about in more detail in a moment, is designed to get more water into Lake Mead. Those are simply to buy us time to negotiate the 2026 guidelines. And I think, Mr. Chairman, in your report, that's exactly how you phrased it. It buys us time so that we can negotiate the 2026 guidelines. How will we operate the river starting on January 1, 2027, going for at least 20 years? Those plans can go for 20 years. They could be longer. It's up to all of us to negotiate. Our representative on that is the general counsel from the Mojave County Water Authority. Mojave County Water Authority has a seat on what DWR and CAP call the Arizona Reconsultation Committee, the ARC, and they are the committee that takes over about 45 different interest groups, puts them in a room, and works with them through modeling and through negotiation to figure out what is Arizona's position going to be in the 2026 guidelines, and how does DWR and CAP operate among those 7 states in this negotiation. That's a long-term process, and Mojave County is well represented by having a seat on that. We have a seat there, I would suggest to you, because we're right in the middle of all these issues. Mojave County has a water transfer issue, Mojave County has a groundwater issue, and Mojave County obviously cares about the operation of the river up and down. Of the 164,000 acre feet of priority 4 water that's available for our development along the river, priority 4 water, 102,000 acre feet of that lies in Mojave County. Thus, you are right at the center of the discussion. So now I'd like to turn to the slides, and Sam has assured me that you'll soon see them on your terminal. You probably have a paper copy also. We're starting with the 2022 Arizona Tier 1 reduction, and there's only 9 slides. Mr. Chairman, this is not a 50-slide portfolio. Won't take all day, but we'll get through these slides, and again, please ask questions if you have any questions. Where are we right now in in the reduction of river water because we are in shortage, right? Right now we are in a Tier 1 reduction for 2022. That means that Arizona loses 512,000 acre feet of water. We're going to leave that water in Lake Mead out of our 2.85 million acre feet that we normally get. That means if you are priority 5, you're losing about 4,000 acre feet, and CAP takes cuts of about 508,000 acre feet. There's no reduction of priority 4 on river water. Why is that? Because the 2007 guidelines were carefully negotiated with the Mojave County Water Authority leading the charge for Mojave County way back when the 2007 guidelines went into effect. Priority 4 water was held harmless and does not face cuts. I don't know that we can make that happen in the 2027 guidelines. Everything will be on the table. And so the cuts to our river water users is something that we should look out for. Priorities 1, 2, and 3 are not cut. Who's in priority 1, 2, and 3? Priority 1 are people who have what's called present perfected rights, or they're in the decree of Arizona versus California, and their water rights are in the decree as ordered by the United States Supreme Court. Who might that be? That includes the Colorado River Indian tribes. That is really important because the Colorado River Indian tribes recently succeeded in getting their draft bill introduced by Senators Kelly and Senator Sinema. That would allow them, if it becomes law, to lease water off reservation. That's super important to Lake Havasu, Bullhead, and Kingman because that's water in the future that we might be able to lease. Are there other people who want to lease that water? Absolutely. People throughout Central Arizona would like to lease that water. Put it in the canal and send it cascading uphill to Phoenix, Tucson, Pinal County. But the people who have high priority are the people who are going to get water most reliably in the coming century. So priority 1 and 2 is important. Priority 3 is pretty much Yuma. All those Yuma farmers and districts have priority 3 water because they had contracts in effect before 1968 when we passed the act through Congress to authorize the Central Arizona Project. So if we could go to the next slide, please. This is a slide you've probably seen many times. It's a pretty busy slide, so I would just direct you to the red box. The red box tells you where we're at right now. In January, we are in a Tier 1 shortage. And if you look over under Arizona's category, you'll see under the combined volumes of shortage reductions, you'll see that we lose 512,000 acre feet of water. Nevada loses 21. The lower basin states are giving 533, and the Republic of Mexico is giving 80 acre feet. So the 80,000 acre feet, pardon me. So why do I put this busy slide up for you again? To ask you to look to the next row down. That's a Tier 2 shortage. There's a chance we could go to Tier 2 shortage in 2023. We would be below 1050 in elevation, and we between 1050 and 1045, you'll see that our Arizona number goes up to 592. Nevada has 25. California doesn't yet give up any water under this drought contingency plan. That changes under the 500 plus plan that the chairman talked about this morning, and we'll go through that now in detail. Next slide, please. In the 2026 guidelines, where Mojave County Water Authority has a seat, High Ground watches this very carefully with a series of other stakeholders. We meet with those stakeholders to get their impressions and where they think is going, where we think this is going. It's a variety of stakeholders who are knowledgeable about the river, and one of the many clients who care about this is obviously you in Mojave County. This is an initial condition scenario of estimated impact. This is modeling. And that MOG name is the Modeling and Analysis Work Group of the ARC. Yes, we can bring you a blizzard of acronyms every day of the week if you want more. I'm sure you don't. This summarizes teams working on modeling, trying to find out what the heck the river is going to do. And in the scenarios on the left, 1 through 6, there's a variety of scenarios where we look at how has the river behaved in the last 1,500 years. Where do we think we are? And red means there's a higher impact on our Arizona and cap water. And I give you this slide not to make you a modeler with 3 math degrees, but to simply say there's a lot of red on this map because the hydrology does not look good. That brings a sense of urgency to us in our 500-plus plan and in our work on Colorado River transfers and the 2026 guidelines. These various hydrologies all look bad in the coming years. We have to prepare for that. Next slide, please. This is a quick scenario, a quick, nice map to show you where the various reservoirs are on the Colorado River system. And there are some upper basin reservoirs that are very small, frankly, but they're doing okay. If you look at Lake Powell and Lake Mead, you'll see we're not doing okay. When you have 34% full in Lake Mead, that's the lowest it's been since we filled it up. That's a problem. Lake Powell is not much better, sitting at 29%. To give you a comparison, the Salt River Project reservoirs, last time I checked, were about 69% full. Salt River reservoirs about 69%. This gives you an idea of where we're at, and it's a good map to show you the upper and lower basins are all in the soup together here. Next slide, please. So the end of water year 2022. So we make these predictions. The U.S. Bureau of Reclamation makes these predictions. All the basin states verify all of this and watch this data like a hawk. CAP and SRP and the Department of Water Resources, they all watch this like a hawk. We're just showing you where Lake Powell is right now and where Lake Mead is. And Lake Mead is sitting at 1053. This is a projection of where we'll be at the end of the 2022 year. So it's not below the 1050 mark, which would mean we'd be in Tier 2 shortage, but it's pretty darn close. Next slide, please. Here's a percent of probability of where we're going to be from 2022, 3, 4, 5, and 6. This takes you right to the end of the 2007 guidelines. That's why 2026 is the last year there. Look at the center line that's bolded. Shortage condition of any amount in Lake Mead. That means we're below 1075. In 2022, it's 100%. We're going to be there. But look at 2023. It's 94% and then 97%. We're going to be in a Tier 1 shortage for the next 4 years, according to our best predictions. But look at the level below that, where it talks about, could we be between 1075 and 1050? Look at those high probabilities there. We are facing in 2023 a 78% chance that Mead is going to be a little greater than 1050 and below 1075. This is the results of modeling done very carefully by USBR and modeling that we all watch. As these models change, we could come back to this board and say, here's the reason the model have changed, here's the dire nature of this, or it could get better. We model for good conditions also, because you never know what the winter is going to bring us. It's just in the last 22 years, it has not brought us much. Next slide, please. The 1030 consultation process is ongoing, and you probably never heard of this consultation process before in your life. It was tucked into our drought contingency plan. It said that if we had a prediction that we were going to go, right, we're going to decline to elevations below 1020, that we would have to do something about that as a group of 7 states, 10 tribes, and the United States government in working with the Colorado River. So that's the 1030 consultation. If the 24-month study for minimum probable inflows will be at or below 1030 anytime in the succeeding 2 years, the Secretary and the lower division states shall consult and determine what additional measures to do. That took place in August when the prediction was we were going to be below 1030. So now we are in that consultation process, and the 500-plus plan that you heard about is the result of that consultation process. Took us 5 years to negotiate the DCP, took us 5 months to negotiate the 500-plus plan. Why are people working with a sense of urgency? Because the hydrology is really bad. Next slide, please. Here's the 500-plus plan. 2 years, we're audaciously summarizing it in one slide, okay? Here we go. It's a 2-year plan, although we expect it to go all the way through 2026. This is a 2-year plan. It has 4 types of voluntary activities. We want additional intentionally created surplus in Lake Mead. We want to reduce people taking their ICS out. Remember, ICS is kind of like water that has somebody's name on it, like a deed, and you can move that ICS around. This would cause the lake to crash more, so we don't want those ICS acre feet to be released. We also want system conservation water. System conservation water is where you conserve the water, you put it in the river system, it doesn't have your name on it, you can never take it out. It's there forever. That's what the Crits have done for 3 years running, funded through the Drought Contingency Plan. They put 50,000 acre feet in the lake each year, right? And it stays there forever. And then system efficiency. We're going to pay some people to do more system efficiency to keep water in the lake. The funding commitments are just as the chairman read out this morning: Arizona, California, Nevada, and U.S. The part in blue on the right-hand column is the most important part. I direct your attention there. Remember, long ago I came to the board to say you need to support the Drought Contingency Plan because for the first time California agrees to share in the shortage with us. California is sharing in the shortage today, along with Nevada and Arizona. The 222 target volumes of the 500-plus plan to get water in Lake Mead. 223,000 is going to come from Arizona, 215,000 is going to come from California, Reclamation is going to put in 62,000. In the 500-plus plan, California joins us in sharing the shortage and making more water available in Lake Mead. That is a really big deal because in 1968, we cut a deal to fund the Colorado River project, and we called it the CAP authorization, the Central Arizona Project authorization, and that went through Congress on the condition that we were last in priority. Now we have our sister states joining us in sharing in the shortage. That's a very big deal. Next slide, please. How are we going to get there in Arizona? And this affects Mojave County because Mojave Valley Irrigation and Drainage District is participating in this plan, we hope. We haven't had an announcement. We know they've been asked to participate, and since they put water in the lake for intentionally created surplus, we think they'll do that again. They have an allocation of about 42,000 acre feet. MVIDD is crucial to this county's water future, and their involvement in this is a very constructive turn of events. We're going to pay tribes and non-tribal interests 30,000 acre feet we hope will come from on-river folks. 193,000 will come from CAP users. And what will happen is they'll be paid about $261 an acre foot to leave their water in the lake. So some of these have become public already. Colorado River Indian Tribes has already agreed and reached a deal. Gila River Indian Community, which remember is in central Arizona but has a very large allocation of Colorado River water. I believe it's 312,000 acre feet from a settlement and an act of Congress done in 2004 by Senator John Kyle. And that settlement opened the gates for lots of other settlements. So they have water available, and they are joining this also. Some cities are joining this, right? City of Phoenix has stepped up, and they are leaving some of their water in the lake. Now, the cities always say, we'd rather have water than money, right? But in this situation, we need to get water into the lake to keep it from crashing. So there's a variety of people who are negotiating now. We don't have a final list. I think we're going to hit our number of 223,000 acre feet that will stay in the river in behind Lake Mead. It will stay there in 22 and 23, but the plan is for it to stay there in 24, 25, and 26. And when January 1, 2027 comes, we will now have a new set of guidelines called the 2026 guidelines, and those guidelines will control how we operate the river for the next 20 years or the next 30 years. But between now and 2026, we need to buy time to negotiate, to figure out what to do for a river that is over-allocated. So, Colorado River is supposed to generate 16.5 million acre feet because we put that down on paper. The upper basin gets 7.5 million, lower basin gets 7.5 million, Republic of Mexico gets 1.5 million. How much water is the river giving us? 12.5 million maybe. So we're a little short. And we've known we've been short through 20 years of drought. The guidelines negotiation and making the 500 plus plan work gets us to the end of the 2026 guidelines, and then we will have new guidelines that this board will be asked to review and take part in as we move forward. And remember, our representative who sits on the ARC right now is Mojave County Water Authority. So that's a crucial player. That is the end of the slides. I hope it is. Is there another slide? No, good. By popular demand, there's no more slides. The last thing I would say to you, members, Mr. Chairman, and members, is the Wallapai tribe continues in their work to reach a settlement for their share of Colorado River water. That became very public in the fall of 20 when the chairman, Dr. Clark, made a big presentation in the Governor's Water Council down in Phoenix. And so that process is ongoing. We continue to work with Supervisor Lingenfelter, who is your designated appointee, to work on that issue. And if you need to know or would like to know more about that, we can do that in an executive session. That negotiation is covered by a non-disclosure agreement. So, Mr. Chairman, I am truly surprised no one had a question in the middle, but surely they have a question now. I'm at your beck and call.
Questions? Okay.
Mr. Chairman, thanks for the opportunity.
No, I'll ask some questions.
Okay, good.
HC, come all the way up.
We've designated the chairman to ask questions.
We're talking about Nevada. Nevada still does the 1-for-1, right? They get credits on their effluent?
They do, and they get about 300,000 acre feet, and they take less than that. But yes, they still do that process.
So about 20 years ago, I testified against them putting a new dump into the lake because they had problems with their suction being right next to where they were dumping at. And the people in Nevada didn't think that was a good idea, but at that time, the fish were being changed. We're having fish that you normally have two eyes, have one eye. We're having a lot of problems with those. We're seeing drugs and treatment drugs also. So say if you're having cancer treatments, you might already have that cancer drug in your system because it's in the water, and now it makes it less effective. Is anybody looking at that, especially now if the water's dropped, and Vegas, I'm guessing, is still dumping just as much as they can into it?
But, Mr. Chairman, people are looking at that in great detail. First of all, you're absolutely right. Their intake, a miracle of engineering, is in the deepest part of the lake, so they can get water out of the lake even if the water won't pass by the dam, which we hope never happens. To answer that question is yes, the Department of Environmental Quality watches very carefully the NIPDES permit that Nevada has to treat that water and put it back in the Colorado River. And when I was at DEQ, we cared an awful lot about the standards of that. So yes, there are people watching that NIPDES permit to make sure not only that the standards are excellent, are strong, but that they are following the standards.
I guess what bothers me about that is we had the abnormalities with the fish that many years ago under the standards. It seems like maybe our standards aren't that good because it doesn't affect Nevada. It affects Bullhead and Havasu and all the downstream users. And then, nobody thinks because for all the time we've had toilets, it's like, oh, flush your medicine down the toilet, so everybody flushes their medicines down. Also on the CAP, are they selling water from the CAP, or are they pumping it in groundwater? Into the ground?
Yeah.
Storage.
Yeah, Mr. Chairman, members, very good question. A lot of the water that CAP users have are going to what's called groundwater storage facilities now. They're going to farmers in Pinal County to use that water on the crops, and then the city gets a credit for that water going in the ground. So yes, a lot of CAP water is going in the ground, but nowhere near as much as past years because there's just not any excess water anymore. So CAP is indeed selling water. They're selling less of it because more of it is staying in the river. They are raising their rates, so to speak, because running the canal is a flat cost, and you have to raise rates. That's a matter of great debate in front of the CAP board. But to answer your question, yes, it's still a mixed bag. A lot of CAP water is going in the ground, especially in Pinal County under the Drought Contingency Plan, to try to protect those farmers as their 30-year deal to get water from the CAP was coming to an end. We were trying to get water into their hands, but the storage is not nearly as much as it used to be.
Okay, when this was put in, it was obviously we're going to transfer the water down, and then instead of the most logical thing to me would have been you transfer the water down, just like you're saying now, you have a fixed cost. So you say, okay, Phoenix, Tucson, everybody, this is where you get your water. It costs you $1 a gallon or whatever. But that's not what we did. We started injecting it in the ground and let them continue to pump groundwater, which screwed the whole thing up. Have those aquifers been refilled with this great plan that we've had?
Mr. Chairman, members, yes, some of them have. The Tucson active management area is probably the most successful in that because the city of Tucson and their partners down there, they take all of their CAP water and put it into the ground in these retention basins so that it is filling up that aquifer. And then they pump from different locations and then treat it and sell it. So yes, some of the aquifers have done well. Some areas near the Phoenix active management area, those aquifers have also recovered because people have been injecting this water in. So some of those basins are doing very well. We're approaching safe yield in Tucson, but we have not reached it. Phoenix is not approaching it at the same amount. But yes, the putting water in the ground, CAP water in the ground, is helping those aquifers. And maybe most importantly, for those of us who remember 1986, California used to use our share if we didn't take it. And so they were over the 4.4 million acre feet. They just took what we didn't use. Water banking, started by Governor Symington in the early 90s, has resulted in our full share coming out of the river, going into central Arizona, and then either being served or being put in the ground. So that part of our CAP operation has been a roaring success because now we use our full allocation.
It's a little interesting when you start talking about water for the river cities, because wasn't too many years ago I brought them water and they had no interest in taking the water even and set it in their water allotments for free. And those same cities are the same that bought Cibola water previous. So it's kind of odd that we're fighting the lease of Cibola water when we bought the Cibola water to begin with. When you talk about the...
Mr. Chairman, can I respond to that just for
Sure.
a moment? You and I have discussed that many times. Moving Cibola water north and south along the river is exactly what Mojave County wanted to do, and all three cities enjoyed something out of that. But you're right, some cities were not as interested in their water future in past years. I grant you that. I tender to you that the hydrology of the Colorado River has sharpened all of our focuses, and now they're really interested.
Okay, yeah, because this wasn't, I don't want to say 8 years ago when I brought it up and nobody was interested. When you're talking about the area up here around Kingman area, is the majority of water or the expansion we talk about, oh, we don't want any more farms, we don't want, I don't know how we're going to handle people who bought land and now we're going to tell them how much water they can have with that land. With the expansion of the city of Kingman, I'm guessing they're probably the biggest user of water in the aquifer?
Mr. Chairman, members, Representative Cobb sent a letter out in the study committee to try to answer that question. And so the city I think they recounted it's about 7,000 acre feet a year they're using, and with growth, they're probably going to get up to 8,000 acre feet. The farms combined are about 32,000 acre feet a year, and if they build out all the way, which, by the way, they say they're not going to, it would be at 100,000 acre feet. So the issue of what we do with the farms now was hotly debated in the committee, and Representative Cobb's amendment number one, or recommendation number one, was to create an RMA, but to grandfather in all current users. And so that would provide assurance to those people who have bought land and put wells in, whether they're pumping out of them or not, that they would be grandfathered in. So that's a matter of I think that's a matter of high interest on the bill going forward about what to do about the people who've already made an investment.
Right, I understand that, but say just the regular person sitting in the audience out there and hasn't done any development yet, then we're going to have to make some decisions on, well, not this board, but if they put it in, what kind of water they can get, whether they can develop it for an industry or a house or a single family.
Yeah, Mr. Chairman, you're exactly right. That's why her amendment talks about grandfathering all users in, domestic, commercial, industrial, agricultural, all users, so that it would be absolutely clear whether you had a 35-gallon-a-minute well or a 7-gallon-a-minute stock tank, or you had a 1,000-gallon-a-minute well that you're going to use for commercial agriculture. We would grandfather those people in because of the concerns that you just articulated.
Right, but say you had just 40 acres and you hadn't developed it, are you only going to be allowed to put one residence on it?
Very good question. The theory behind all of this, which this board first tendered to the legislature in January of 2018, was that the local management plan for this rural management area would not be composed by the director of DWR, which is the way they do it in the AMAs. The director has complete power. Here it would be a local board. We propose 9. The committee proposed a member board of 9 members. They would propose the management plan or the best management practices. And it seems to me, having been here since 1954, that it's unlikely that our local board is going to say to somebody who owns 40 acres, for example, and has water, that you're not going to be able to develop that. The local committee would then propose management plans. Now, there may be a management plan that says, if you're going to develop your 40 acres and you're going to use X amount of water for domestic, then you're fine, you don't even have to report. But if you're going to put in an industrial facility and you're going to use 25 1,000 acre feet a year, you have to report. So there'll be different management goals, but they will only come from the local committee from the bottom up. So I don't think anybody who owns 40 acres and has water under their ground has anything to worry about, because the locals will be devising the plan.
Thank you. No further questions? Supervisor Lingenfelter.
Thank you, Chairman Johnson. As everybody can see, Mojave County is in the spotlight on all fronts when it comes to water. Thank goodness it's not going to be like it was last year, the legislature. You can actually go down and provide testimony in person, which is going to be hugely important as we continue to advocate for these things. One of the other recommendations that the West Basin Water User Study Committee put forth and which was adopted was that an RMA advisory council, when they put together their plan, they have to consider any adopted general plan from a city or a county, and also any comprehensive economic development strategies. So, and again, the water budgets ties into that too. I think it's going to be really important for all of us on the river, and even in Kingman, which relies solely on groundwater, to bolster the water element of our general plans. I think in Mojave County's general plan, the water element is a little over 10 pages, maybe around 15 or so. I forget the exact number, but really bolstering that and saying, hey, this water is here's what we're going to need in the future, and it's already spoken for. So when you're looking at transfers, it's going to become something that is adopted by the voters of this area. So you just can't have an organization that's not tied by statute to go through the proper planning process. They can't do that end run anymore. So a lot of important work, and look forward to next year. Thank you.
All right, no action needed. Thank you, Mr. Cunningham.
Thank you, Mr. Chairman and members.
Take a 5-minute break. Call the meeting back to order. We'll have a call to the public. Jennifer Esposito.
Jennifer Esposito, Kingman. Regarding the call to the public at the last meeting, I'm just curious, could you dig yourself a bigger hole if I loaned you a shovel? Maybe I should just rent you a backhoe. If I would have known what a steaming load of BS that KRMC was going to dump on you, a backhoe might be in order. But what I forgot to tell you at the last meeting, when I told you about how the Zelenko protocol over the counter is so successful at treating COVID, I forgot to tell you that Dr. Zev Zelenko was nominated for the Nobel Prize in Medicine for that protocol. And because, like Supervisor Angus, I'm about finding solutions. I also forgot to tell you how you could find that online. If you put in Zelenko protocol, that's Zelenko protocol into your search engine, it will take you to VladimirZelenkoMD.com where you can read it. Now, I've got more news for you that nobody else is telling you. This is really important. 2 common over-the-counter drugs have been found to reduce like 99% of COVID in early testing. So I'd like to read you this. This is from SciTech Daily. It says a pair of over-the-counter compounds have been found in preliminary tests to inhibit the virus that causes COVID-19. University of Florida health researchers have found. The combination includes diphenhydramine, an antihistamine used for allergy symptoms. When paired with lactoferrin, a protein found in cow and human milk, the compounds were found to hinder the SARS-CoV-2 virus during tests in monkey cells and human lung cells, et cetera, et cetera. So just to be clear, diphenhydramine, I believe that's Benadryl, and lactoferrin can be found in a product that I have used myself called Immunocal. You can go to immunotech.com and order it, or you can just go on Amazon. So if you try maybe that protocol and or with the Zelenko protocol, you won't need to go to KRMC. Additionally, on that subject, I would also like to point out that if there's a staffing shortage, you might want to just go to hendersonhospitals.com because there's a beautiful state-of-the-art facility up in Green Valley. And a friend of mine who's a nurse told me that's where all the nurses from KRMC went. I'm just saying, just a rumor, can't confirm it, but they probably don't have a wait. You know, it's been 10 months since my husband was seen in the ER at KRMC and left a wait in the emergency room, waiting room for 10 hours. So I'm pretty sure that the drive to Henderson is less than 10 hours. And once he was admitted to KRMC, they enrolled him in Medicare without our consent, even though he was covered by the VA and had his VA card in his wallet.
Thank you. Jeff Esposito.
Okay, I'm going to read a statement by Dr. Robert Malone, a virologist and an immunologist and the inventor of mRNA. My name is Robert Malone. I am speaking to you as a parent, grandparent, physician, and scientist. I don't usually read from a prepared speech, but this is so important that I wanted to make sure I got every single word and scientific fact correct. I stand by this statement with a career dedicated to vaccine research and development. Before you inject your child, a decision that is irreversible, I wanted to let you know the scientific facts about this genetic vaccine, which is based on the mRNA vaccine technology I created. There are 3 issues parents need to understand. The first is that a viral gene will be injected into your children's cells. This gene forces your child's body to make toxic spike proteins. These proteins often cause permanent damage in children's critical organs, including their brain and nervous system, their heart and blood vessels, including blood clots, their reproductive system, and this vaccine can trigger fundamental changes to their immune system. The most alarming point about this is that once these damages have occurred, they are irreparable. You can't fix the lesions within their brain. You can't repair heart tissue scarring. You can't repair a genetically reset immune system. And this vaccine can cause reproductive damage that could affect future generations of your family. The second thing you need to know about it is the fact that this novel technology has not been effectively tested. We need at least 5 years of testing research before we can really understand the risks. Harms and risks from new medicines often become revealed many years later. Ask yourself if you want your own child to be part of the most radical medical experiment in human history. One final point, the reason they're giving you to vaccinate your child is a lie. Your children represent no danger to their parents or grandparents. It's actually the opposite. Their immunity after getting COVID is critical to saving your family, if not the world, from this disease. In summary, there is no benefit for your children or your family to be vaccinating your children against the small risks of the virus, given the known health risks of the vaccine that, as a parent, you and your children may have to live with for the rest of your lives. The risk-benefit analysis isn't even close. As a parent, grandparent, my recommendation to you is resist and fight to protect your children. Why are you people supporting the health department in their vaccine of children? I mean, that is a crime. You should do something about it. You have children. Just, stop the crime. Go talk to your health department manager and rein her in. Let's go, Brandon.
All right, consent items 5 through 38. Supervisor Angus?
Mr. Chair, if I could, as you get into the consent, I apologize to cut in. Item 38, I need to correct some information. I did the write-up on item 38, and I put in some incorrect information. One of the things I stated in there was that there are no taxes due, and I apologize for the misinformation. There are current year taxes due, that's calendar year 21, of $48 or $41.46. The flood control district is still willing to accept that property and pay those due taxes.
Okay, I need a motion on Supervisor Bishop?
After I ask to talk, fill out a yellow form.
Only if somebody pulls it, sir.
Huh?
Only if somebody pulls it off the consent.
Oh, I got other things to talk about.
He signed up for call to public.
Pardon?
I signed up for call to the public.
Oh, call to the public.
No.
All right, let me get the consent and we'll come back to you. Get that out of the way.
That's what I'm bitching about, is some of the consent.
All right, we'll go back. Scotty, we'll open up call to the public. Come on up.
All right, thanks. Ooh. If you want to know what I think about another pointless resolution, watch the Bullhead City Council meeting tomorrow night when Dr. Zahari presents one from that lowlife Warmack Hospital. I used my VA card there too. Guess what? They got me in collections agency from back east. They own a collection agency back there, I think. And I have to call Phoenix now. Oh, man, to hell with Warmack. Listen to the meeting tomorrow. We can get the National Guard up there, but they belong on the border. Maybe we get Kamala Harris here. Now, what I want to do here, I was going to try and pull, why on channel, on this 39, why aren't 10, 19, and 21 also moved to that part? You should do a 39, 1, 2, 3, and 4. You've got procurement and public works. You're already deciding on what the fees are going to be before you get to channel 39 here, or channel 39. You know what I'm talking about. Speaking of TV, I want to know, I found out we have lawyers. What are these guys out of Phoenix? TV lawyers. And I'm going to talk Television Improvement District. This is from a year ago meeting, December 20th. Who is William Ken Keene? Lawyers Howard Lieberman and Wilkinson, Parker, Barker, Nauer. I mean, I'm going to take this up with a new person you appointed to replace Mrs. Orr, which when I had questions about the TV thing, she was very helpful to me. And I'm going to give this new lady, or whoever you appointed, a chance to get her job together before I start hitting her up. So I'm not going to bug her yet. It'll be this afternoon. But, you know, they took off a whole bunch of channels. All of a sudden, 2 months ago, they just went wiped out. We no longer have a weather channel. They moved it to Channel 3, which is a crappy weather channel, so we don't know whatever. We have no Spanish channel. We have 6 shopping channels now. Thank you. I don't use one of them, so they're not on my TV. We lost Get TV, Court TV, or whatever. I'm sick of this shit. This is FCC says we will have free off-air channels. Now, whether they get shipped up here, I don't know. I can't find the FCC anywhere. And these lawyers, like I say, she's going to have to answer these questions. One thing you did, good, on the consent agenda, you haven't done it yet, I guess, is thank you for doing the Mountain View Aztec Road thing. That's a very good thing.
All right. Items 5 through 38 in the consent with the changes to item 38. Supervisor Angus had nothing. Supervisor Bishop?
No, nothing.
Supervisor Gould?
Thank you, Mr. Chairman. Number 14.
Supervisor Lingenfelter?
Nothing today, Mr. Chairman.
All right. Need a motion to approve 5 through 38 with the changes to 38.
So moved.
Second.
Motion and second. Further discussion. Hearing none. All in favor signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. Item number 14, approve the utilization State Arizona cooperative contract. Supervisor Gould.
Thank you, Mr. Chairman. I was just curious if, since these are hybrid gas-electric vehicles, if we consider that or come in at an additional cost, what is the payback period for that additional cost over the gasoline version of that car?
Hello, Chairman Johnson and Supervisor Gould. I don't have the answer to your question now, but I could get that information for you at a later time. I'm here to answer any questions that you have related to the procurement process in place of Tara while she's on scheduled time off.
Thank you. Wonder if Mr. Latosky has the answer to that question. Or why did we choose hybrids over the gasoline version?
Chairman Johnson, Supervisor Gould, we as staff have not conducted a payback analysis in purchasing the hybrid vehicles. That's something we certainly can do for the Board of Supervisors. It has been our intention to move toward a hybrid vehicle for our car rental fleet only. These are not going to be assigned vehicles. And the idea being we wanted to just pursue a hybrid and not a full plug-in. So these are vehicles that would charge on their own just through the operation driving. Have to figure though that we're going to see at least a 15 mile per gallon bump from a typical passenger car being about 35 or so at best.
Yeah, I was just wondering with how long is the payback? Do we pay that back before we wear the car out and sell the car out?
Typically we see our car rental vehicles driven about 10,000 miles a year, so without a calculator, I'd probably do some rough math off the top of my head and multiply it by the $3 per gallon gas. But generally the sedans, thinking back, and again, I'm thinking kind of on my feet here, where we would probably see those costs come in about the $25,000 to $28,000 range. Of course, with vehicles, the way that they're priced now, the market is just a totally different market than when we were procuring cars a year ago. Sure. So seeing $32,000 for a rather storied and reliable, Camry type model probably is not terribly out of line with what we would normally see for a regular gasoline powered vehicle, which we usually opted for those Ford Fusions or something similar. So again, kind of going back to the math would say, at least 10,000 miles a year in driving, and then you're saving the 15 miles per gallon. So it, probably the payback could come, and we always utilize our vehicles to about a 6-year time frame, or 120,000 miles. So got to think about the payback being within the 6 years, which I would reason that it probably would be in this case.
Thank you, sir.
Thank you.
Mr. Chairman.
Maybe I had a question for Mr. Letowski. Did you say these are just going to be used for loaners?
Chairman Johnson, that's correct. We were actually aiming to, and it should be in the board.
Yeah, the back.
I am correct. The county attorney's office, community services, and then legal defender, and then the carpool. So I totally apologize. There are going to be 3 of them assigned. County attorney, community services, and legal defender, and then 2 in the carpool.
Okay, that's all. Thank you.
I take that back. Thank you.
Supervisor Gould.
Mr. Chairman, I move that item 14 be adopted.
Motion second. Further discussion. Hearing none, all in favor signify by saying aye.
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 Both same side. Motion carries. Item number 39. Scotty, you fill out a form for that.
Yeah, how come we're not starting this until the 2nd instead of the 1st? You've got an auction there on the 1st of January. See, now you've already approved a lot of things. Like number 10, $2,340 per year to something that I think can be done in-house. We need another paper pusher from out of state, out of county, out of whatever.
We're on the park fees adoptions?
Yeah, 39.
Yeah.
Yeah, the county fair,
Okay.
right? Yeah. Number 10, you're going to audit a bunch of whatever. I don't know what these people are, why you can't do it in-house. Number 10. I requested that to be moved. You know, you need to, whatever. You're not going to do it. I have no problems with this number 19. I don't drink, so I could care less what you do there with the permits. I suppose you got some legal grounds that you have to follow. What was the other one I wanted moved? Okay. The fees. I saw the fees about a month ago, and what you're doing is you're going to jack up my entrance fee and how much you're going to charge, like the pie auctions. They have to set up 3 or 4 days in advance. This is going to cost him an extra $400 or $500 every time he rents it, and he's rented that place more than anybody else. He'll just raise instead of our 10%, he'll charge 11 or 12% to the people that buy things there. And we pay sales tax on stuff too there. So you've already, when we went from $2 gate fees to $3 parking fees, and then we find out they've got $200,000 in their little pocket, where is the audit? I've asked for that every time I've gotten up here, and I doubt if I'm going to let that go. And you ought to bar them from renting the place and putting on their own shows. They're the ones that caused this problem. I know they're real nice people. I don't know any of them. I care less. But I want them nowhere near that fairgrounds. Yeah, well, anyway. I think there ought to be if they rent a place for 4 days, you ought to give them like $50 off a day. There's things you can come back here in 6 months and redo, and Steve, you know, I'm sure people are going to be in contact with him, but I think they ought to. A gun show, they know how to set it up. They have to set up days before, too, so you're not just getting Friday, Saturday, and Sunday. They got to set up the day before, so you're getting 4 days. So I think some of this needs to be discussed later.
Thank you. Anyone else?
Just forgot my little friend.
Is there anyone else wish to address the board? I'll close the public hearing. Discussion by board members?
Chairman Johnson? Thank you. If I could get Steve to come up to the podium, please. Thank you, Steve. I appreciate the work that you guys have put into this so far. Being this is new to everyone, and being the newest council or supervisor, I wanted to know regarding the fees in our parks. Has it always been that there's just been one rate for everybody, or has it ever been considered to give discounted rates to county residents, the people that pay the majority of our property taxes, and having the out-of-state or out-of-county, visitors that come here every weekend in the summertime and just take over our parks a higher fee?
Supervisor Lingenfelter, great question. And we've adapted by more of a demand-based pricing. First, I'd like to address the county residents. We still establish an annual pass at $40 per year or $20 after July 1 for county residents only. So that has been in effect and has not changed the pricing, and we are not proposing to change that pricing. The demand-based pricing is really tied to Davis Camp, and we have first started some 3-4 years ago with pricing a per-person rate just for the summer holiday weekends, Memorial, July 4th, and Labor Day. Then we went to every weekend during the summer demand-based pricing per person. That just reflects the tremendous influx of persons that we get and welcome largely from California. So I hope that more or less answers the question, where we've kept our day use rates at the $10 per vehicle, not per person, steady, and that reflects our cost effectiveness that we can offer the folks of Mojave County, as well as that important annual pass, which I do know many do take us up on that.
Great. So the annual pass is still effective on those
and
holiday
for county
weekends
residents,
as well?
That's correct. Yes.
Residents only.
And holiday weekends as well.
And holiday
correct.
weekends. Okay. Very good. Thank you.
I have a question. I see you didn't look into the bleacher costs because you're still giving them less than we're ever going to make off of them. We're ever going to pay back them.
Chairman Johnson, yeah, referring to the grandstands, we did lower that from $1,200 to $1,000. However, we did increase daily rental rates for some of the larger exhibition type buildings, and that really was just a reflection of our scan of what was a limited amount of other county fees that we were able to scan, but none of the other counties had grandstands at grandstand rentals of that magnitude of the 1,200, so we lowered it to 1,000.
My confusion was I thought it should be higher because you've got a payback time. Mm-hmm. We're charging $1 a seat. Nobody charges $1 a seat. You're not even charging that for the 90 seats. You're charging $75. Mm-hmm. I mean, some of these fees, I mean, you've got to get the money back. There's a liability issue on those too. It's just a setup. I can't believe that you can set up portable 90 seats for $75 and tear them down. I just find that very hard to believe because you've got it, if somebody's renting them or even putting them out there, we got to send somebody or a couple guys out to drag them out, bolt them in, make sure they're all up to standard and the right height and all that stuff, and then come back and tear them down for $75. I think we're losing money. But that was all I had. What's the pleasure of the board?
Chairman Johnson?
Supervisor Lingenfelter.
Make a motion to approve the adoption of the proposed new and modified fees for the Mojave County Parks, including the Mojave County Fairgrounds, to be effective Saturday, January 2nd, 2022.
Second.
Motion second. Further discussion? Seeing none, all in favor, signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. Item 41 is approving the signing Board of Supervisors Resolution 2021-237. Supervisor Angus.
Thank you very much. Just a little recap. Probably 8 or 9 months ago, less than a year ago, we applied for about $5 million for the ERAP, the Emergency Rental Assistance Program. for people who were having, couldn't pay rent because of COVID-related problems. And it was kind of slow coming in, and we didn't understand why. We just figured that people didn't need it, and then we were asked to approve another $5 million for ERAP 2, but this time the qualifications were much broader, and the debate we had here as a board was, is this the county we want to be? To me, it was the onset of socialism, just having people get used to going to the government. So it might look a little odd that I brought it back, and the reason I brought it back for discussion, I wanted to hear the board's ideas, is that I asked Michael Smith from Community Services if he were to ask the powers that be if this new batch of money could be used by people who lost their jobs or left their jobs because of vaccine issues. And if Michael, is it okay if Michael comes up, Chairman Johnson? Sure. You know, I was kind of reading what you put on to summarize the issue, and the last sentence says, additionally, for many residents, the cost of rent and utilities has increased during the past months. The agenda item is to reconsider applying for, but what does that have to do? I don't understand what the cost of everything has gone up. So are people just now, is the qualification so broad that anyone who's having trouble paying their rent still could do it? You have to prove, to prove it's COVID related. And the other information you put in the backup was a little vague as well. I mean, they don't have to explain. They just take it for at their word that it's COVID related, which might explain why they were able to use the next $2.5 million pretty quickly. You know, I'm not saying this will happen, but as we know, anyone who's in government, anytime there's a government program, people will find a way to game it. We know it, right? So I'm hoping this is not what's happening here. So I just wanted to ask the board, now that there might be people now hurt because of losing their jobs because of the vaccine, even though, as we heard, it's on hold, is this something you want to reconsider? I'm not even sure, frankly, after everything I read, because even the backup that said that they can apply if it's vaccine related, it was vague enough still that I could see it almost coming back at some point saying no. They didn't say absolutely. They said, well, we don't really ask, if it's COVID related. So I didn't really see that as 100% yes. So that's where I'm coming. That's why I brought it back.
Can you answer any of that, Mr. Smith?
Chairman Johnson, Supervisor Angus, thank you for the opportunity to present to you today in regards to this. So with the backup, I did work with Tyler on that. But I would say in regards to, if we just look at our county in general, the cost of rent and where that is, and I'm not tying that to this, but if we just look at that, where our rents are as a county, they are extremely high. In regards to what you brought forward in regards to can somebody apply or can they game the system? Possibly. But as you think of that, there are requirements that it has to be COVID related. So you have to state on the application how is it COVID related. They don't specify as to how that would be. It just has to be a COVID related expense. So if I lose my job because I refuse to get the vaccine, that would be a COVID related expense. And then I could then apply for rental assistance.
How do I prove that? How do I prove that I left my job or because of COVID-related thing? I mean, there has to be proof of that, or like it says here in one of your letters that they just take them at their word.
So people can self-attest, but when you think of that, they would have to go through the process of, if they lost their job, they would have UI, right? They'd have to fill out the form. They'd have to say, I was terminated because, and then they would ask for the backup information as it relates to that.
Yeah, because in this letter, at present, the ERAP application does not request a specific reason for the financial hardship and accepts a self-attestation to its existence. So they take your word. If you say, I lost my job, and So, given all that type of stuff too, I'm not sure. What do you guys think?
Chairman Johnson.
Supervisor Lingenfelter.
Thank you. Michael, can you refresh my memory on what are exactly the criteria to qualify for this fund?
So really, I kind of went over that briefly just a little bit ago. You really have to have a COVID-related expense. So somehow you have to have been affected by COVID to qualify for the program.
That sounds really subjective and broad to me. That could be anything.
It is pretty broad, and I could go back and pull up some of the other details, but really, for somebody to qualify for the program, they have to have adversely been affected by COVID in relationship to what they're asking for.
Yeah. I had a hard time, like many of the board members did last time. When you look at what we've gone through in this country, I think it was the first president we ever had, George Washington, all the way to the first George Bush. It took to get to the first $6 trillion of the national debt, and then within a matter of months, we doubled it with the CARES Act, right? And then, like 40% of the money out there now has been printed in the last 18 months or something ridiculous like that. It's incredible, and not in a good way. Incredible. So, I hear what you're saying about the cost of rent and things like that, but it would make more sense to use funds like this to subsidize projects that would create more affordable housing and not just hand it over to somebody to pay rent. And once it's gone, you're just kicking the can down the road, in my opinion. You're not really solving anything. Maybe for a couple of months for somebody, but.
Supervisor Lincoln-Felter, I would agree with you on that note. That is why, as of last week, I reached out back to the Treasury to find out if and when we get to the 60%, I believe it's 60% of funds spent within this $5 million. So if we go back, if the board goes back and votes today that they would like to move forward with this, once we get to a 60% threshold, we can do exactly what you're talking about. Those things are still coming forward through the Treasury. I reached out to the Treasury and to our person at DES for guidance on the Treasury. They're still asking for that, and they're saying that is supposed to come soon. So that would be the part that you're talking about in regards to that. What can we do to help communities, building projects, things of that nature, so that money wouldn't go there. So if we spent money like we did with this current program, probably within the next 6 months, we could start looking at a countywide with our housing issue, start putting things to move this forward. And if not, the funds are there through the state, just to be clear as well. We don't know if those funds will currently be there because those are just allocated as a general fund. So people from the county could apply still, even after we run out, because currently we have about $320,000 before ERA 1 funds are expended, which in my estimation will be by the end of the week.
By the end of the week. Are there metrics that you track, to show what you got from this program?
So I could provide you households. I think in the backup there was information listed in regards to the cities. I'm only going to shoot off the top of my head because I don't have those in general, but it was broken out by cities, so I could provide that information if that was something the board would like.
Mr. Chairman.
County Manager.
Mr. Chairman, board members as well, just a quick thought or two on that. One is ERAP 2 would be similar to ERAP 1, the one that is currently in program. The qualifications would be the same, and it's being administered for Mojave County by DES. If you recall, we came to the board and recommended that they are more equipped and suitable to administer this program for us than we were, and the board approved it. So they are validating, they are checking, they're reviewing the criteria and approving applications accordingly. With that said, with the number that Michael just shared with the board, under 10% is remaining from ERAP 1. When it runs out, it runs out. The state funds may and may not be available for those in Mojave County that need it. If the board, to pick up on Michael's point and Supervisor Angus's. If the board was to approve this, it will continue to be administered as ERAP 1 has been. And once we hit that 60% threshold, the current criteria, to the best of our understanding, will allow 25% of that, if it's not needed, to go toward affordable housing. So we're just mindful of that as the board consider this item as it's being brought back to the board. But I thought it would be helpful, or it would be of value to mention those points to you as you consider this or reconsider it.
Chairman Johnson.
Supervisor Bishop.
I am in support of going forward with this because I think, as I mentioned before, Cornerstone Mission is not taking any more homeless people into their mission or providing food or any other benefits, and I think some of the other shelters are in the same situation. I think if we continue to let Arizona DES administer this, it might keep some good folks off the streets while we on the county level try to figure out how to build affordable housing and maybe get this Good Jobs Challenge grant where we can get some training, get people back to work and back on their feet. So if we don't use this money, no harm's done. If people do apply for it that obviously need it, I think it's the right thing to do.
Chairman Johnson?
Supervisor Angus.
Is there any way, because we had to decide this when we took ERAP 1, can we do the administration here? Because the way I'm reading this now, and I'm almost kind of sorry I brought it back, because it is so vague and open that it's almost like, anyone who's having problem with their rent. Because you can make a case that COVID affected everything, right? That's what President Biden says. Everything is inflation because of COVID. So if we could control it and make sure that it's going to people who really need it, I maybe can support that a little bit more. But, being now that it's being run, it's outside of our purview, it's not in our hands, I still have a little bit of heartburn about it. And I'm sorry I made you do all this work, because it's still the same issue as it was before. But they've, even in their own paperwork, said that they have loosened up the qualifications. I don't know.
Supervisor Gould.
Thank you, Mr. Chairman. Michael, can we add our own additional restrictions to this money?
I would have to check into that, Supervisor Gould. I don't believe that is the case. It's a DES-run program, meaning that they're actually facilitating that across all of the state for the community partners they have. So the way it's set up, and just to go back to Supervisor Angus's question, because it ties back into your question as well, is really, do we have the capabilities to run this program? We do not have the capabilities here at the county to currently run this program. To run this program, it would require many staff members to do this, and it would fall back onto the finance department. Currently, with our ARPA funding and all the things that we're trying to accomplish within the county, this would be an unrealistic expectation without the ability to hire, 5, maybe 8 more people to run the program. And I think there could be other things that our program currently with the Good Grants Challenge and other things that we're really looking to do on a county level, it wouldn't make sense to be running this program.
Well, the reason I ask is I might be able to support this if we could limit it to only people that have lost their job because they refuse to be vaccinated because they have weak-kneed employers that aren't willing to stand up to Joe Biden and the Democrats in Washington. Other than that, I can't support it, because it just encourages people to be on the dole and to not provide for themselves. And we've almost created universal basic income now without it even being voted through Congress, through all these ridiculous government programs. But if we could limit it to only people that had lost their jobs for refusing to be vaccinated, I might be able to support it.
So Chairman Johnson, Supervisor Gould, members of the board, I think as we look at this program in general, we're talking about a very small segment of our population, the people that are hurting the most and need it the most. If you look at it, they've only approved a little over 1,000 applications. Mojave County has 217,000 people in it. That's less than 1%. it is a small percentage of people are the people needing the services. We're not providing the service. We're working with DES. We can only go by what DES provides us. But when we do look at the numbers, it is a very small population.
Thank you, sir.
George Lingenfelder.
Thank you, Chairman. Michael, is there refresh my memory, an income cap to qualify?
So there is a guideline that goes with that. I don't have that particular number off the top of my head. This program is being run by DES and they oversee that. But I could find out that information and provide it to you. There is a cap as to how long you can be on the program. You can only be on the program 18 months.
No, I'm not talking about that. I'm talking about, let's say I make $100,000 a year or more, and can I still qualify for the program? Or is there a requirement that, I show that I only have maybe a month of expenses left in my savings account or some sort of qualifiers like that?
Supervisor Lingenfelder, there definitely is a cap. I want to say it's and this is just off the top of my head, right? So don't hold me to this. But I want to say it's either 140 or 120% of area median income is what the targeted group is that they're looking to assist. But I can definitely find that information and bring it back to you. It's just been quite some time since I looked at those guidelines.
Median income of the county is?
It's right around $45,000, depending on which.
Right.
Chairman Johnson.
Supervisor Bishop.
To add to my earlier comment, this also affects landlords that are leasing properties that may have a mortgage. So if their tenants can't pay the rent, they're out that funding and maybe they can't pay their mortgage, so it kind of spirals. But I think this program is for our very low income people that are hurting already, just paying their rent, and then they lose a family member to COVID or a job, then it almost can become life-changing to them and maybe put them back in with living with their parents or friends or even a homeless shelter. So I think since it's a small percentage, 1% of our population, you said, it's the right thing to do to try to help out during this pandemic until we get this affordable housing where people can move into new homes and get new jobs with this other program. I mean, it all kind of
to address what Supervisor Bishop said, earlier today we heard from an expert that COVID is here to stay. So again, what we're doing is we're getting people used to coming to the government for their basic needs. And yes, I do understand, there is a population. But I still have, when I first wanted to revisit this, it was before you came in front of us and told us that all of that money was used. And I still have some questions about that. Maybe I could talk to you, that almost half of that money, $2.5 million, was given away relatively quickly. Was that stuff that was in the pipeline? I mean, what was the usual time from the time people applied till they got reimbursed?
So just to come back, so it was a little, I want to say $5.8 million was appropriated for program funds. Of that money, $5.5 million has been expended to this point. In regards to the time frame of when you apply to when you receive your payment, it's really tricky, Supervisor Ingus, and the reason I say that is because it really requires two people to act upon it, meaning that the landlord has to act as well as the tenant needs to act for ERA 1. And so with that being said, if both people don't put the exact same thing on the application, so if I owe $800 a month for rent, but the landlord charges me $25 late fee, if they don't put $825 and they both don't concur the exact same dollar amount, then they have to go back to the process and start over. But to answer your question, on average, it takes about anywhere from 6 to 8 weeks from when you apply.
Okay.
I have a motion.
Chairman Johnson, I'll make a motion that we approve BOS resolution number 2021-237.
I have a second. I'll second for discussion. Any discussion on it? All in favor, Supervisor Lingenfelter?
Chairman Johnson, just a follow-up question regarding the questions that you've heard from the supervisors today regarding, can it be even more narrowly tailored? Regarding, people that have lost their jobs for particular circumstances, or maybe, they're not making 120%, that it actually goes to the people that really need it, the lower income, because 120% of median income is like mid-50s, right? So, would you be able? What's the cutoff to apply for these funds to allow you time to check into these things?
I'll come back to that, Supervisor Lincoln-Felter. I don't have that exact dollar amount that you're requesting, but I think in between now, with this resolution, we'll actually be able to apply for the funds. If the board went that direction, by the time we come back to sign the IGA to work with that, we definitely could make sure that we worked with DES and found out if that was even possible in regards to your question and Supervisor Ingus's question as well, and Supervisor Gould in regards to narrowing the guidelines as to it applies to Mojave County.
What's the deadline for applying for these funds?
Currently, there is no deadline, Supervisor Lincoln.
There's no deadline.
That's what the Treasury has expressed to me at this time.
Thank you.
Supervisor Bishop, I'm sorry, Chairman Johnson.
Supervisor Angus.
Would you be amenable to just continuing this till the first meeting in January, so some of us can have our questions answered and maybe get a little bit more clarity?
Absolutely. If it means possibility of this failing, I'd rather continue it than to see it fail, because if anybody's ever not been able to pay their rent in this room or in this audience, it stings, especially if you have little kids at home. So I'll amend my motion.
I'll withdraw my second.
Yeah, thanks.
So we have a new motion?
I make a motion that we continue this item until the first meeting in January of 2022.
I'll second that.
Any further discussion? Hearing none, all in favor, signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. All right, I'm going to go to item 45, discussion possible action, accept the monetary donation, the amount of $5,000 for PetSmart and PetSmart adoption prep grant, the amount of $75,000. County Manager Alter.
Thank you, Chairman and board members. I would like for Nicole Mogmalley to come up to the podium and address the board on this item, please.
Good morning, Chairman Johnson, Supervisors, and County Manager. I am Nicole Mangiamelli, Mojave County Animal Shelter Manager. Over the past 2.5 years, the shelter has been very successful under the direction of Mojave County administration. One of our primary goals, always, is to adopt out and transfer as many of our homeless or displaced cats and dogs to loving homes as possible. Since July 1st of 2019, via adoption, transfers to no-kill facilities, we have rehomed approximately 6,500 animals instead of euthanizing them. On average, we receive from 300 to 500 animals per month, with the summer month being our biggest challenge. Our success thus far in reaching these goals is largely due to our partnership with PetSmart stores and PetSmart charities, who provide a family-friendly environment for and high visibility for our adoption events. Due to our high adoption rate and commitment to saving these animals, we are eligible to receive grant rewards which support our adoption efforts by providing spays, neuters, equipment, and adoption supplies. In October, we applied for and were awarded a grant of $75,000 from PetSmart Charities through its Adoption Prep Grant Program. Additionally, we recently received another $5,000 for completing 250 adoptions over the last quarter in their stores. Right now, I would like to acknowledge Dan Hernan, if you will stand up. And he is the manager of PetSmart in Kingman, and Jessica Ackerman. She is the manager of PetSmart in Bullhead City. And it would be a long laundry list to tell you how much they do to help us to get through these events and prep for them, and the support that we receive from them all the time. So I just wanted to thank them for their help in getting us there to the grant.
Thank you very much.
Any questions about it? No. Good. Thank you.
Thank you.
With that said, Mr. Chairman, we respectfully request the board approval for this item.
Okay. The motion?
Chairman Johnson, I make a motion that we approve the monetary donation in the amount of $5,000 from PetSmart and the PetSmart Adoption Prep Grant in the amount of $75,000, ratifying the signature of the animal shelter staff. And I thank them very much.
Second.
Motion second for discussion. Hearing none, all in favor, signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. All right, item number 42, I will pull and continue until next time. 43, discussion possible action, press release information from the Mojave County Public Information Officer. I placed this on the agenda. We just talked about this, and maybe I misunderstood, but press release was no problem with. I agreed with the press release, but we had, I don't know, what, 10, 12, 13 additions on it, and I think that's, I mean, in my personal opinion, that's where we're getting into problems where unless we say every time we do a press release, everybody gets a chance to attach something to it. I mean, I know we disagreed about, doing our own press releases, but I think if we start doing one, then you've got to offer them to everybody, or you're going to have problems with that. Was the only reason I brought it up.
So Chairman Johnson, it's my understanding that the press release as it stands was perfect, but the attachments, I think that's up to the media to do their research if they want more information, but to put that all out, it just seemed like an overkill and way too much information for a press release. Press release should be factual and to the point, but not a documentary on itself. That's my thoughts.
Thoughts? Do we want to make any changes to it, or leave it the way it is? Or with no direction? I guess we have none now.
I would like to see it continue the way it has been in the past, just press releases with the guidance that we've given in the past. Maybe the county manager can kind of tell me if we've changed the process or anything, or why it was done this way when it hasn't been done that way in the past. It was just kind of weird.
Mr. Chairman, Supervisor Bishop, I don't really have any comments on that. We had the practice before the board discussed this item and approved proceeding with putting the information out. So we did. So we're happy to work with the direction that the board provides us.
George Lingenfelder.
Thank you, Chairman Johnson. I think I'm the last one to the table, but which press release are we talking about? I don't. Is it the water press release?
The water one, and I guess my concerns were we were putting out, even though they were attachments, still looked like we're putting out the mayor of Kingman's press release, all these other people's stuff, and while the water issue might be something that basically what we're all concerned about, but you're on that. At some point, if we start, in my opinion, if we start having add-ons to it, the press release itself was perfect, said all the information the public need to know, but then you could get one supervisor goes, well, how come I wasn't asked to give a addition to it? So to me, it just makes it easier if we do the one press release where it says what is going on with the county, and then if individuals want to put something or call the press to say, hey, I've got the quote on that, that was just fine.
my personal opinion is I think that every supervisor should be able to partner and use the PIO. Personally, I don't see myself in competition with any other county supervisor. I mean, you can talk about whatever you want to talk about. I mean, if you want to give every supervisor an opportunity to give their quote on a press release, that's fine by me. Most of the time, I'm going to say no. I mean, I care about water, I care about economic development, things like that, and I'll probably give a quote there. But I mean, that's really what I mean. As long as the information gets out there, I mean, who cares?
Well, I guess where the problem would come from, the person on, say, the losing end decides he's going to make a statement, which we've seen before on, not with the board here, but I've seen it in other places where, you know, once the board makes a decision, Mojave County Board of Supervisors made a decision. Whether I voted for it or against it, Mojave County's policy is that, and I don't think we should have, you know, coming out from the PIO that, oh, everybody voted for this, it's a great idea, but Supervisor Johnson said it was the worst thing he ever saw. You know, I mean, it's still the board, the majority of the board runs the county, and it should be theirs, and we shouldn't let minority opinions get in there. Not that there was a minority opinion in this, but I could see where if we start letting everybody put it out, there will be a chance when the minority says, you know, I need to put something out to clarify my position because I think everybody was wrong on this.
That's what Facebook is for.
To tell you you're wrong?
Well, to go out there and say, you know,
Yeah.
this is why I voted the way I did,
Yeah.
but I'm sorry. Chairman Johnson,
Supervisor Angus.
again, I do think that the PIO should be at least help out. Now, it used to be, it goes to the chairman and the county manager, correct? Before it goes out, it has to be approved. We used to do that.
Must have changed that when I got in.
Seriously?
I never see one.
What happened? When you were chairman, Gene, didn't you have to see them? What happened?
Mr. Chairman, Supervisor Angus, nothing happened as far as I'm concerned. This has been the practice since day one, since I walked in. Board business is communicated to the public through a press release, and we ensure that it's accurate and factual, and we release it. We have not sent it to the chairman for review. If anything, I review some of them, not all of them.
Well, I think that was maybe that's some of the problem. Maybe we should go back to that. So if there is something that, you know, might be out of sort of our policy, because our policy is that once the board, if someone goes off the rails, we'll know, you know, we'll know it. So can we go back to that? Do we even have to vote on it? I mean, that was just something that we always did the whole time I've been supervisor.
Mr. Chairman, Supervisor Angus, we can do what the board directs us to do. My sense is it will create situations where a press release needs to go out and the chairman may not be available to review it.
Well, in that case, we had the vice chair do it. That we didn't have problems. I mean, once in a while, maybe it went out a day late, but I thought that process worked, and I think it worked well.
So you've, again, please understand, I'm not trying to question or debate you on this, Supervisor, but you have a professional in the public information officer that you've hired to communicate the board decisions, the board actions, the board discussions to the public. As long as those are reflective of the board deliberations, I'm not sure what the chairman is going to be reviewing or the vice chairman is going to be reviewing it for. And we could, I'm not really sure of what the obstacles become. Is the chairman going to say yes to this and no to that? And when the board has acted on an item, please help me out.
Okay, I understand your assertion that we have a professional. I understand that, but I don't think we're utilizing that professional to the max that we can. I love Roger, but to justify this position and the salary that we give, I just don't think we use them enough. And if there is a need in some districts, and I think we all understand that it's not for promotion. It's to get information out. And if there is ever a time that one supervisor has an issue, they can pick up the phone and call the other supervisor, or they can call you to tell the supervisor. I just think we're making it much more complicated than it needs to be.
So, Mr. Chairman, Supervisor Angus, thank you. And that is what we practiced. We did offer supervisors to work with them, not certainly to write it up, but to work on a press release that would go on the supervisor district letterhead.
Right.
So it did not come from the board as a whole, but from that district. And we did do that until that item came to the board. We can still do it going forward with the same guidance and practices that the board press release will speak of the board as a whole, would go on a letterhead. If an individual supervisor wishes to put something out, we'll assist in reviewing it and disseminating it.
Okay.
And try to...
So it will be disseminated from the county. It will come from the county, even though if it's on my letterhead or Ron Gould's letterhead, it will still be sent out from Mojave County.
It would be...
PIO?
Well,
or should it be done by...
We will provide the list of... I guess it can go either way, Supervisor. There's really no harm. But in the past, what we did is we provided the... If it's something in District 2 that pertains to District 2 and not District 5 or District 1, then we would provide the media outlets and the information for folks in District 2 so that information can be
It comes from their office, is my point.
By the district office,
Right,
yes.
because Chairman Johnson's been doing that for years and successfully.
And we recognize that, but Chairman Johnson had not and does not ask for assistance.
Right.
We recognize that, and he does it well. There are other offices where they have asked, and we provided assistance. So we will be more than happy to continue that practice as well.
Okay, so if I want to write a press release, I can call Roger up and say, will you help me with this press release? And that's all fine. And then it comes from my district. It comes from my email account, not from the county's email. Is that what you're saying?
Yes, Supervisor, that is what I'm saying. And the only clarification perhaps is you would say, Roger, I want to put out a press release. Here is the contact information. And then we take it from there.
Okay.
Review it and again, work with Karen to disseminate it out of your office so it does get out to the public as needed. And we maintain that independency.
And the newspaper still won't pick it up, so it's a difference. Okay, thank you.
I think that answered the question you had. Mine's still out there. It's like today we did just receive money for the PetSmart. Now we're going to put out, I don't know if Roger's going to do it or not, but Mojave County graciously receives $80,000 from PetSmart, and now we're going to attach 5 different press releases from all of us to it, or should there be no pressure?
Photograph also. Can I get a picture?
Well, we're going to do that when it comes to the part where you voted against the people getting assistance. So they know. Yeah, in the minority view.
No, that didn't happen.
Well, no, but when this one I was bringing up, the water one, we had, what was there, 13, 14 additions to it? There was everybody and their brother. Didn't even have to work for the county. Okay. We attached from ours. If we're going to do it, it should have said, well, we're attaching it. Supervisor Angus, Supervisor Bishop, Supervisor Gould, everybody else should have been on there. I'm just saying you do a press release. The idea is to get the information to the public, and the rest of us can do it without it, just like you said,
Okay.
I don't know.
Chairman Johnson.
Supervisor Bishop.
I think if we need a motion on this, I would say that press releases are to get information out for the county as a whole and not for political gain or recognition of any individual elected official. That should cover it.
Sure, I guess that'll. Sounds good. Do you have a second? I'll second it. Discussion. What's the problem with that? What's she saying?
So they're going to go out with the no names?
Mojave County as a
Well,
whole.
now they just,
So half of the time you're mentioning somebody's name in the press release. So to send them out with no name, I think is kind of odd.
I don't think there's never been a name in them.
And I only sent one out through the PIO anyway, and it took so long because everybody else had to check whether they had vacancies, appointments, and 3 weeks later I finally got my presser out.
Oh.
So at that point, I no
was-
longer send out pressers to the PIO, I send out pressers directly.
Yeah,
That wasn't a press release for any political gain. I mean, you were just announcing that you have openings. So.
Yeah, but it's still cumbersome when I'd like to fill those positions, and I ended up waiting because they had to check with everybody else. And to me, it seemed like that I was determining whether so everyone would somehow get equal billing on vacancies.
Yeah,
I think
see
we're
what-
overthinking this
Yeah,
way
I
too
think
much.
it's just, on something like that, if districts have vacancies, I mean, usually you probably do it yourself, you know. But
the easiest way is just do it myself.
Yeah, but
It's as apt to pick up what I put out as they are to pick up what Roger puts out.
yeah, but the other one is just for, like we said, with PetSmart, Board of Supervisors, you know, accepted it, and you know, general things like that. So we don't say, you know, because we sometimes in the past we said, well, and the chairman wants to say it's a great idea. I've never done that since, well, probably because Sam never asked me, but.
Chairman Johnson?
Yeah, I got cut out of it.
Chairman,
That's right.
Chairman Johnson, I think we've had that discussion years ago about, not quoting any specific, although I still have no problem quoting the chair. I mean, the chair is the chair and they oversee it all, but I don't think we do that, and I think the point has been made about what it should and shouldn't be.
So we don't think we need a motion then? All right, I'll withdraw my second. Withdraw your first. All right. Think you have direction, County Manager? Or do we need to beat it up some more?
Sorry, Mr. Chairman, board members, did you just ask me if I have any?
Do you understand what we discussed overall?
Yes.
Okay.
Let me, if I may, rephrase,
Sure.
since you gave me the platform. Here's what I understand. We will proceed with the practice of county business acted on by the Board of Supervisors being communicated to the public through a press release that would say the Board of Supervisors approved, denied, declared, proclaimed, so on. With that said, any other communications that pertain to a specific district from a district supervisor, we will assist with those in reviewing and disseminating that information. We will provide the media outlet contact and list, and we will work with the district office assistant to get that information out, and we will do it in the most expeditious way we can.
All right.
That's what I understand. Will that work for you?
Sounds good to me. I was trying to get this meeting over with. Item 44, discussion approve the recommendation of the county manager to appoint Bobby Shin to the position of legal advocate, effective date Monday, December 20th, at range 31, step 3 plus, or 104,644.80 annually.
Motion to approve.
Have a second?
Second.
We have a motion and a second for the discussion. Hearing none, all in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Item number 46, approve the appointments of members of the Mojave County Board of Supervisors, Regional State, and Mojave County Boards for the 2022 calendar year. Do we have any additions or changes people would like to do?
Chairman Johnson, I have a couple things.
Sure.
On the Mojave County Water Authority, I'd like to step down as the alternate. I think my plate's pretty full for this year, and I would like to ask you if you would be willing to take that over as the alternate.
No one else wants it, I'll be glad to take it.
Okay. Do we need a motion on that? If
You have another one too, you said?
Yeah, with the County Supervisors Association Legislative Policy Committee. I think Supervisor Angus would like to stay on that committee. Because I'm chairing that committee, I will lose my vote. Supervisor Angus would take that vote, but I would like to be appointed as the alternate in case she's not able to be there to vote. And that's my only changes.
Any other changes? All right, everybody's, pardon? Well, no, well, the changes would be Mojave County Water Authority, second seat to me, and second seat to the CSA policy to Supervisor Bishop.
So that's the motion, I'll second it.
Oh, okay.
All right, all in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Item number 48, discussion possible action to accept the resignation of Sarabad Constable Ray Cullison. Establish a timeline for selecting and appointing a new Sarabad Constable. Establish a process for selection and appointment of a new Sarabad Constable to fill the current term being left vacant by Cullison's retirement.
Chairman Johnson?
Yes, Supervisor Angus.
It would be against statute if we were just to leave that position open because it's up for election instead of putting someone in, paying for all the training and all of that hoopla. Can we do that?
Attorney.
Chairman Johnson.
Supervisor Bishop.
If I could just chime in on that, when I was constable and Robert Crabtree was ill for over a year, my office covered his duties during that year period. So it was not difficult to do that, even with the travel back and forth from Kingman to Lake Havasu. So I think if the other Kingman constable could cover for a few months, that'd be the most logical way to handle this, I would think so.
And
Any
Mr.
discussion?
Chair, Supervisor Angus, the board has a few different options. Certainly that's one there that Supervisor Bishop just mentioned. The board has to do two things. One, accept the resignation. The board in theory could, delay the accepting the resignation for a period of time. And then that second step of establishing a process to appoint someone or have someone fill that position. So could there be that opening held open all the way through the election? Most likely, yes.
So if the motion was to accept Ray Cullison's resignation and not fill that position before the election of 2022, would that work?
Mr. Chair, Supervisor Angus, I'm not aware of anything that would say that would not work. Certainly if I'm given some time and I can look that up, I can get back to the board on that. But at this point, I'm not aware of anything that would say you can't do that.
Well, that's my motion then.
Do I have a second?
Second.
Motion second for discussion. Hearing none, all in favor, signify by saying aye.
Aye.
Any opposed, same sign.
No.
Motion carries. Item number 49, discussion of possible action to approve the sole source contract number 22 SS28. Had a chance to read it, the backup. Does anybody have any questions?
I have a couple of questions. It's
They
probably
come forward.
Sheriff Department questions, I would think.
Good afternoon, Chairman, Supervisors.
Thank you for coming. If you can give me a brief overview of what we're doing here.
Yes, sir. As a matter of fact, I brought an executive from the company that can cover most of the intricate details or any questions you might have. I just came up to let you know that the Sheriff's Office is extremely excited about this program. Basically, in a nutshell, it creates a direct link between the school and law enforcement. For example, if there's a situation at the school and they need to get through and get us real-time information, this program actually does that. If there's a, God forbid, an incident going on, we're going to get a bunch of 911 calls, and those 911 calls are going to go straight to our dispatch anyway. And then, depending on the amount of 911 calls, they may roll over to other counties. This way, we get real-time, direct information from the school to law enforcement, and we're able to send out resources a lot more efficiently and quicker.
So is this something that the Sheriff's Department's going to monitor during school hours, or is it something that you're just going to turn on when the situation arises?
No, sir. It's a direct link between the sheriff's office and the school enacts it. Or they if there's a problem, they start the program. We do not watch the schools. We don't have access to until it's turned on.
Which raises another question. What if they are unable to turn that, physically prohibited from turning that system on?
I actually had that same question. It's not just one, say, administrator that may have access to start, let's say, a lockdown procedure in the school. It will be up to the schools to come up with their policy on how that's done, maybe from the principal to the vice principal to whoever they put on that. Anybody can actually start, like I said, a lockdown procedure, sure, and then open it up to law enforcement. I know Ms. Kuhn here can answer any questions above and beyond what I could answer.
Okay.
Yes, sir.
Thank you, Undersheriff. Chairman and members of the board, thank you very much for your time today. I'm Chrissy Kuhn, Chief Customer Experience Officer for Mutual Link. I come at you as also a former law enforcement officer, 15-year veteran of law enforcement in my hometown of Las Vegas, as well as a 5-year veteran of the federal government, where I actually traveled around and met directly with police leaders, chiefs and sheriffs, and architecting solutions and leveraging technology to be able to improve their operations. Mutual Link is a 16-year company. It was born out of the interoperability challenges of 9/11. Today, we specialize in advanced communication solutions and workflow automations that are aimed to improve the safety of communities across the nation. This opportunity in front of you today is a bill from the School Safety Interoperability Program, and essentially it's aimed at doing a few things. In active shooter situations, as we've seen, the threats to schools have actually increased. This year, there's been 32 since August 1st. One of the first things that we're looking to do is expedite that notification into the 911 centers. The faster that we can get that information into the 911 centers, the faster that we can get a response en route from your local law enforcement agencies. The second thing that we do is we bring together the local law enforcement agencies that are already partnered to support Mojave County. And so there's a number of agencies that are already here working day to day on the street. Rather than having that phone call come into 911 and then dispatch a specific deputy from the sheriff's office, what we do is we automate from that panic button that we've put in the hands of every teacher and school administrator a series of workflows that come after that. One of the first things it does, it's an automatic, direct push-to-talk communication with the 911 center so that that school administrator can give in real time exactly what's happening in the school. It immediately automates a mutual aid channel that connects all of your local law enforcement into a single conduit of information so that when information is coming in regards to what's happening, everybody's getting it at the same time. And then within that mutual aid channel is the ability to share pictures, video, files, evacuation maps, emergency operation plans, incident command maps, anything that can give your first responders better situational awareness as they're coming into the area. And Supervisor Gold, to address your question, we're the only company that does incident-specific interoperability and mutual aid channels. And so what that means is that the school maintains control of all of their assets, including all their video systems. The sheriff's office has access to none of it until an active shooter situation is triggered from those panic buttons. And then part of that automation is to share the ability to share video cameras remotely with sheriffs, deputies, and at the 911 center. To your point, they're probably evacuating off-site. This isn't a manual process where they have to go in and do that. It's actually remote from the district level to share those cameras directly with law enforcement. So it's typically going to be somebody at the district level who has access to those cameras already in the video management system and then authorizes access to that in the incident to the 911 center, and then they can drag and drop that video into that channel to share it directly with first responders on scene. So I'll pause there in case you have any questions.
More questions, Supervisor Gould? No. I have some questions. The school, is this all on the phones? So does everybody have to have a cell phone? So I'm a school teacher and I go, hey, kid's got a gun in my thing. I click it in and it goes.
So Mutual Link is the digital backbone. We connect a series of disparate systems. So we can do it through soft panic buttons, which would be on their phone. We can do hard panic buttons if they actually, some teachers choose to wear like a pendulum around their neck. That would activate that series of automations, or there could be a hard panic button, say at the desk in the front office, or it can also be brought up in a browser window in the actual desktops or smartboards that are in the classrooms. So it can be in a number of different devices that the teacher or school administrator could activate that panic button.
So it's up to the school to decide if substitute teachers get it or janitors have it or whoever needs it. How many schools in Mojave County have signed on to this program?
So particularly with this funding, we're looking to cover 4 districts and 25 schools in the pilot program. We're working directly with Sheriff Schuster and the school superintendents to determine which districts and schools we start with. The idea being that we would eventually bring it to every school and district within Mojave County.
And that costs them how much a month?
How much per month?
For the schools. You're not doing this for free, right?
No, sir. So the cost for the panic button solution is $2,500 per year per school. And then at the district level, there's some hardware and additional equipment that goes there, and that can run up to about $10,000 per district per year.
The 4 districts, you know what they are?
We've not identified the 4 districts just yet.
What's the pleasure of the board? Supervisor Gould?
So what happens if I cut the phone lines and the internet lines?
So we have, with our technology, there's also a solution that we're bringing to the state of Arizona that involves a wire mesh network technology. I can't go into the specifics of all that technology, but what it essentially does is it can actually create like a bubble of connectivity.
I know what a mesh is.
Okay. So we're working to also integrate that in the first quarter of 2022 so that it is agnostic of, broadband carrier, phone lines, if the internet's cut. There's some resiliency in that system and how those panic buttons function.
Good. That's great. Thank you.
I have a motion.
Motion to approve?
I have a second.
Second.
Motion second. No further discussion. All in favor signify by saying aye.
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 Opposed, same sign. Motion carries.
Thank you very much for your time.
The last one, right, Jenny? We're adjourned.
Legislature.